NCLEX-PN Archer Review Part 3. Question 1. The nurse is caring for assigned clients. The nurse should recognize that the client at greatest risk for compartment syndrome is the client who has which of the following? Here are the options. Option A. A left tibial fracture that was recently placed in a cast. Option B. Swelling in the ankles and is wearing compression stockings. Option C. Chronic osteomyelitis of the right femur. Option D. Skin traction following a left hip fracture. The correct answer is option A. A left tibial fracture that was recently placed in a cast. Correct answer. A left tibial fracture that was recently placed in a cast. A client who recently had a fracture in cast is at high risk of. The recent fracture causes swelling, which can be enclosed by the cast. Orthopedic fractures are a significant risk factor for compartment syndrome. Question 2. The nurse is caring for a client requesting to leave against medical advice. The nurse barricades the client in their room because they feel that the client is not safe to go home. The nurse is demonstrating. Here are the options. Option A. False imprisonment. Option B. Malpractice. Option C. Negligence. Option D. Invasion of privacy. The correct answer is option A. False imprisonment. Correct answer. False imprisonment. Refusing to let a client leave against medical advice (AMA) and physically obstructing the client from leaving is a form of false imprisonment. Question 3. The emergency department ED nurse is triaging a client who reports recent international travel to West Africa and has signs and symptoms of conjunctival infection, fever, rash, vomiting, and blood in their stool. The nurse is concerned that this client may have. Here are the options. Option A. Pulmonary tuberculosis. Option B. Encephalitis. Option C. Ebola virus disease. Option D. Inhalation anthrax. The correct answer is option C. Ebola virus disease. Correct answer. Ebola virus disease. West Africa was a site of a recent Ebola virus disease (EVD) epidemic. The manifestations of Ebola include conjunctival injection, fever, rash, vomiting, and blood in their stool. This information makes it reasonable to raise the suspicion that this client may have EVD. Question 4. The nurse is anticipating a client arriving at the emergency department ED exposed to inhalation anthrax. The nurse anticipates that the primary healthcare provider PHCP will prescribe which medication. Here are the options. Option A. Acyclovir. Option B. Zidovudine. Option C. Ciprofloxacin. Option D. Oseltamivir. The correct answer is option C. Ciprofloxacin. Correct answer. Ciprofloxacin. Anthrax is a bacterial infection treated with antibiotics such as penicillin, doxycycline, and ciprofloxacin. Inhaled anthrax is most effectively treated with a combination of ciprofloxacin and another antibiotic, i.e. penicillin, clindamycin, chloramphenicol. Antibiotics are usually given for 60 days because it takes that long for spores to germinate. Acyclovir is an antiviral used to treat herpes. Antiviral medications do not affect anthrax, which is a bacterial infection. Zidovudine is an antiretroviral medication that is used for the treatment of HIV. Antiviral drugs do not affect anthrax, which is a bacterial infection. Oseltamivir is an antiviral drug used to treat influenza. Antiviral medications do not affect anthrax, which is a bacterial infection. Question 5. Hospitalization may affect or delay the progression of which physical development in a 1-year-old client? Here are the options. Option A, walking. Option B, running. Option C, sitting. Option D, crawling. The correct answer is option A, walking. Correct answer, walking. At the age of 1 year, children should be starting to walk. Hospitalization during this age could delay this stage of development. Question 6. The LPN is aware that which of the following maternal infections can increase the risk of congenital heart defects in the fetus? Here are the options. Option A, hair influenza. Option B, adenovirus. Option C, rubella. Option D, measles. The correct answer is option C, rubella. Correct answer, rubella. Rubella is a maternal infection that is known to increase the risk that the fetus will have a congenital heart defect. All mothers should be tested for rubella, and if found to be positive, should have a fetal echocardiogram performed to evaluate the fetal heart more closely. Question 7. The LPN is taking care of a 9-year-old boy who is undergoing testing for acute myeloid leukemia AML. The nurse is assisting with the positioning of this client for a lumbar puncture. Which of the following positions should the nurse place her client in? Here are the options. Option A, prone. Option B, Trendelenburg. Option C, supine. Option D, side lying. The correct answer is option D, side lying. Correct answer, side lying. Side lying is the most appropriate position listed for a lumbar puncture LP. This will allow the healthcare provider to identify the lumbar vertebrae and insert the needle into the subarachnoid space at the L3-4 or L4-5 interspace. Question 8. The nurse supervises a new graduate care for a child immediately following surgery to correct an imperforate anus anortal malformation. Which action by the new graduate requires follow-up? The new graduate. Here are the options. Option A positions the child side-lying prone position with the hips elevated. Option B obtains a rectal temperature. Option C auscultates bowel sounds in all 4 abdominal quadrants. Option D secures the indwelling urinary catheter bag to the frame of the bed. The correct answer is option B, obtains a rectal temperature. Correct answer, obtains a rectal temperature. Immediately following surgical repair of the imperforate anus, the surgical site is very fragile, and obtaining a rectal temperature may cause significant trauma to the suture line. This method of temperature is recommended. Question 9. Which of the following terms describe the soft down hairs present on the shoulders, back, and forehead of newborns? Here are the options. Option A, milia. Option B, lanugo. Option C, vernix. Option D, Mongolian spot. The correct answer is option B, lanugo. Correct answer, lanugo. Lanugo is the soft hairs present on the shoulders, back, and forehead of newborns. Question 10. A client with a history of falls is admitted to the medical surgical unit. The nurse should plan to implement which intervention to reduce this client's risk of falling? Here are the options. Option A, encouraging the client to ambulate independently to improve muscle strength. Option B, verify that the bed alarm is enabled during client rounding. Option C, implementing a fall risk assessment every 2 days. Option D, implementing a restrictive mobility policy to minimize the potential of falls. The correct answer is option B. Verify that the bed alarm is enabled during client rounding. Correct answer. Verify that the bed alarm is enabled during client rounding. Ensuring the bed alarm is on will help notify staff if the client is trying to get up unassisted and allow the staff to intervene and reduce their risk of falling. This client has a history of falls, and it is appropriate to provide this measure. Question 11. Which of the following is not an example of an inspection? Select all that apply. Choices: heart rate and rhythm irregular, lungs clear, skin is clear, abdomen tympanic. Here are the options. Option A, heart rate and rhythm irregular, lungs clear. The correct answer is option A, heart rate and rhythm irregular, lungs clear. Correct answer, heart rate and rhythm irregular, lungs clear. Question 12. Which of the following isoenzymes is most specific to myocardial infarction? Here are the options. Option A, CPKMB. Option B, troponin. Option C, creatinine kinase. Option D, myoglobin. The correct answer is option B, troponin. Correct answer, troponin. Troponin is the most specific isoenzyme when evaluating a suspicion of MI. Levels of troponin will elevate within 3-4 hours of myocardial infarction and remain elevated for 3 weeks. This means that not only is troponin the most specific cardiac biomarker for an MI, it is also the most reliable test to run if the client does not seek care for some time after their symptoms begin. Question 13. Which of the following immunizations is a priority for a client who is 75 years old and has a history of cerebrovascular disease? Here are the options. Option A, hepatitis vaccine. Option B, hepatitis B vaccine. Option C, pneumococcal vaccine. Option D, Lyme disease vaccine. The correct answer is option C, pneumococcal vaccine. Correct answer, pneumococcal vaccine. The is a priority immunization among elderly clients and those with chronic illnesses. This vaccine should be administered every 5 years. Question 14. The nurse is reinforcing teaching to a client about newly prescribed carbamazepine. Which of the following information should the nurse include? Here are the options. Option A, this medication will require weekly dosage adjustments. Option B, avoid taking this medication with grapefruit. Option C, this medication may make your emotions more intense. Option D, take this medication if you feel like you are going to have a seizure. The correct answer is option B, avoid taking this medication with grapefruit. Correct answer, avoid taking this medication with grapefruit. Carbamazepine is an anti-epileptic drug and mood stabilizer. This medication is indicated in the management of epilepsy and bipolar disorder. This medication should not be taken with grapefruit products because cytochrome P453A4 liver enzyme is inhibited by the ingredients in grapefruit, leading to increased serum concentrations of carbamazepine. Question 15. A client who has recently traveled to another country presents to the emergency room with shortness of breath and suspected severe acute respiratory syndrome (SARS). What should the nurse's first intervention be? Here are the options. Option A, Place the client on contact and airborne precautions. Option B. Obtain blood, urine, and sputum for culture. Option C. Administer methylprednisolone 1 gram/Roman-4. Option D. Infuse normal saline at 100 ml/HR. The correct answer is option A. Place the client on contact and airborne precautions. Correct answer. Place the client on contact and airborne precautions. A client who has recently traveled to another country presents to the emergency room with shortness of breath and suspected severe acute respiratory syndrome (SARS). What should the nurse's first intervention be? Question 16. The nurse is planning care for a child who has had a near drowning at a local swimming pool. It would be a priority for the nurse to have which item at the bedside? Here are the options. Option A. Warm isotonic fluids. Option B. Advanced airway. Option C. Rectal thermometer. Option D. Defibrillator. The correct answer is option B. Advanced airway. Correct answer. Advanced airway. Drowning may cause a catastrophic pulmonary injury, and maintaining the client's airway to deliver warm, humidified oxygen is essential. While thermoregulation needs to be attained, drowning results in a decrease in body temperature. The essential item to have is airway equipment. Restoring a client's airway will prevent a serious complication of an anoxic brain injury. Question 17. The nurse is working at the triage desk in the emergency department when a patient arrives and begins speaking in Spanish. The nurse asks if he would like an interpreter, and he shakes his head no. What is the appropriate action for the nurse to take? Here are the options. Option A. Ask around to see if anyone nearby knows Spanish. Option B. Call the receptionist who speaks Spanish to translate. Option C. Pull up Google Translate on the internet. Option D. Request an interpreter from the hospital's interpreter service. The correct answer is option D. Request an interpreter from the hospital's interpreter service. Correct answer. Request an interpreter from the hospital's interpreter service. It is most appropriate to request an interpreter from the hospital's interpreter service. A certified medical interpreter has the proper training to quickly and accurately translate the conversation as well as protect client confidentiality. This is the appropriate action by the nurse. Question 18. The nurse understands that a positive home pregnancy test is considered which level of confirmation? Choices: a possible sign of pregnancy, probable sign of pregnancy, a positive sign of pregnancy, presumptive sign of pregnancy, probable. Here are the options. Option A. Over-the-counter OTC pregnancy tests check for the presence of HCG, which rises when pregnancy has occurred. A positive OTC pregnancy test is a sign of pregnancy, but requires further testing for a definite diagnosis. The correct answer is option A. Over-the-counter OTC pregnancy tests check for the presence of HCG, which rises when pregnancy has occurred. A positive OTC pregnancy test is a sign of pregnancy, but requires further testing for a definite diagnosis. Correct answer. Over-the-counter OTC pregnancy tests check for the presence of HCG, which rises when pregnancy has occurred. A positive OTC pregnancy test is a sign of pregnancy, but requires further testing for a definite diagnosis. Over-the-counter OTC pregnancy tests check for the presence of HCG, which rises when pregnancy has occurred. A positive OTC pregnancy test is a sign of pregnancy, but requires further testing for a definite diagnosis. Question 19. The nurse knows which of the following healthcare providers are responsible for documenting care provided to a client? Here are the options. Option A. The LPN should document the care they provided and the care given by unlicensed assistive staff. Option B. The registered nurse must document all of the care that is provided by the nursing assistants because they are accountable for all care. Option C. All staff members should document all of the care that they have provided. Option D. All staff should document all of the care that they have provided, but the registered nurse is the only independent practitioner that signs it. The correct answer is option C. All staff members should document all of the care that they have provided. Correct answer. All staff members should document all of the care that they have provided. All staff members, including unlicensed assistive staff like nursing assistants, document and sign all of the care that they have personally provided. For example, the nursing assistants will document the vital signs that they have taken, the licensed practical nurses will document all of the treatments and medications that they have given to the client, and the registered nurse will document nursing diagnoses and assessments that they have completed. There is an old saying among healthcare professionals that has been passed on to new generations. The saying is, "I don't care what you did. If you didn't document it, you didn't do it." Documentation is an essential part of client care. Question 20. Which of the following tasks would be appropriate for an LPN licensed practical nurse to take? Select all that apply. Choices: reinforcing teaching to a 24-year-old first-time mother on how to care for her new baby. Adjustment of a 68-year-old patient's cervical traction as ordered by the attending doctor. Obtaining an occult blood sample from a 16-year-old patient with ulcerative colitis. An assessment of a 36-year-old man newly admitted for chest pain. Here are the options. Option A. Reinforcing teaching to a 24-year-old first-time mother on how to care for her new baby. Adjustment of a 68-year-old patient's cervical traction as ordered by the attending doctor. Obtaining an occult blood sample from a 16-year-old patient with ulcerative colitis. The correct answer is option A. Reinforcing teaching to a 24-year-old first-time mother on how to care for her new baby. Adjustment of a 68-year-old patient's cervical traction as ordered by the attending doctor. Obtaining an occult blood sample from a 16-year-old patient with ulcerative colitis. Correct answer. Reinforcing teaching to a 24-year-old first-time mother on how to care for her new baby. Adjustment of a 68-year-old patient's cervical traction as ordered by the attending doctor. Obtaining an occult blood sample from a 16-year-old patient with ulcerative colitis. Question 21. A client has acute bone pain related to metastasis of cancer. The best way for a hospice nurse to assess the client's level of pain is, here are the options. Option A. Check vital signs after giving pain medication. Option B. Note observations about the client's behavior. Option C. Evaluate verbal and nonverbal actions. Option D. Ask the client to rate his pain on a scale from 0 to 10. The correct answer is option D. Ask the client to rate his pain on a scale from 0 to 10. Correct answer. Ask the client to rate his pain on a scale from 0 to 10. Only the client can report on their pain level. It is a subjective perception that should not be judged or dismissed. Asking him to rate his pain on a scale of 0 to 10 should be the guide for managing his care and pain relief. 3 aspects regarding the definitions of pain have essential implications for nurses. First, pain is a physical and emotional experience, not all in the body or all in the mind. Second, pain is a response to actual or potential tissue damage, so laboratory or radiographic reports may not be abnormal despite the real pain. Finally, emotional responses to pain, such as anxiety, depression, anger, and demoralization, may be described in the place of pain. Question 22. While administering digoxin to an infant in heart failure, the nurse knows to monitor which of the following electrolytes. Here are the options. Option A, potassium. Option B, calcium. Option C, sodium. Option D, phosphorus. The correct answer is option A, potassium. Correct answer, potassium. It is important that the nurse knows to monitor potassium levels while her patient is taking digoxin. This is important because if the patient is hypokalemic, digoxin toxicity can be worsened. Whereas if the patient is hyperkalemic, digoxin will not be as effective. Question 23. The licensed practical/vocational nurse LPN/VN is caring for a client receiving digoxin. When examining the client's laboratory data, the nurse should closely review the client's serum. Here are the options. Option A, potassium. Option B, calcium. Option C, sodium. Option D, phosphorus. The correct answer is option A, potassium. Correct answer, potassium. The nurse needs to monitor the client's potassium levels while taking digoxin. Decreased potassium levels hypokalemia may precipitate a client developing digoxin toxicity. Question 24. The physician has ordered a 24-hour urine specimen. After explaining the procedure to the client, the nurse collects the first specimen. This specimen is then choices, placed in a separate container and later added to the collection. Discarded, then the collection process begins. Tested, then discarded. Saved as part of the 24-hour collection. Here are the options. Option A, discarded, then the collection process begins. The correct answer is option A, discarded, then the collection process begins. Correct answer, discarded, then the collection process begins. The client should collect the first specimen, which is considered old urine or urine in the bladder, before the test began. After the first discarded specimen, urine is collected for 24 hours. A 24-hour urine collection may be prescribed to evaluate some renal disorders by showing kidney function at different times of the day and night. The nurse is responsible for providing the collection container and educating the client on how to collect the specimen. Question 25. The client with a history of right mastectomy is receiving maintenance Roman IV fluids via a peripherally inserted intravenous line in the left cephalic vein. The client complains of pain at the Roman IV site. The nurse notes that the infusion has slowed and assesses swelling as well as erythema at the Roman IV site. Which action should the nurse take? Here are the options. Option A, stop the infusion and remove the Roman IV catheter. Option B, insert a new Roman IV in the left intermediate basilic vein. Option C, prepare the client for PICC line placement. Option D, elevate the right arm to reduce swelling. The correct answer is option A, stop the infusion and remove the Roman IV catheter. Correct answer, stop the infusion and remove the Roman IV catheter. This client's Roman IV site shows signs of phlebitis, redness, swelling, pain, and slowed infusion rate. The first priority action is to remove the current Roman IV catheter to reduce the risk of further complications. Localized symptoms of phlebitis typically resolve after discontinuation of the catheter. Question 26. The nurse notices bruises on a client's arm and observes that the client seems afraid and does not speak much. Because these are possible signs of physical abuse, what is the nurse's most appropriate action? Here are the options. Option A. Ignore the bruises, as this is not why the client is being treated, and it is not appropriate for the nurse to address them. Option B. Report the suspected abuse to one of the other nurses and work together on how to handle it. Option C. Report the findings to the appropriate authorities based on state requirements and protocols. Option D. Use therapeutic communication to talk to the client and attempt to get evidence of suspected abuse. The correct answer is option C. Report the findings to the appropriate authorities based on state requirements and protocols. Correct answer. Report the findings to the appropriate authorities based on state requirements and protocols. It is the responsibility of any healthcare provider/team member to report any suspected abuse to the police or designated agency, per state police. Question 27. The nurse is caring for a client who sustained an electrical burn. The nurse plans to take which priority action? Here are the options. Option A. Obtain an electrocardiogram (ECG). Option B. Prepare for an arterial blood gas (ABG) collection. Option C. Provide wound care. Option D. Initiate supplemental oxygen. The correct answer is option A. Obtain an electrocardiogram (ECG). Correct answer. Obtain an electrocardiogram (ECG). Electrical burns are and require the client to undergo cardiac monitoring because of the risk of dysrhythmias. The nurse's priority action is to obtain telemetry monitoring or perform a 12-lead electrocardiogram. Question 28. You are taking care of a 10-year-old with a gastrostomy jejunostomy DJ tube. Which electrolyte deficit is this client at risk for? Here are the options. Option A. Sodium. Option B. Potassium. Option C. Chloride. Option D. Calcium. The correct answer is option A. Sodium. Correct answer. Sodium. There is a large amount of extracellular fluid in the peritoneal cavity, which contains a high sodium content. If this fluid is lost through the GJ tube, there will be a sodium deficit leading to hyponatremia. Question 29. The nurse is caring for a client with a jejunostomy tube receiving intermittent enteral feedings. Which intervention would be the highest priority to reduce the risk of aspiration for this client? Here are the options. Option A. Flush the tubing with 20 ml water after feeding is completed. Option B. Position the client in a left-lying position after feedings. Option C. Assess blood glucose every 6 hours. Option D. Place the client in semi-Fowlers following feedings. The correct answer is option D. Place the client in semi-Fowlers following feedings. Correct answer. Place the client in semi-Fowlers following feedings. The nurse should assist this client in semi-Fowlers position or lay them on the right side following feedings, as these positions will reduce the risk of leakage, gastric reflux, and aspiration. Question 30. The nurse is reviewing a new prescription for amphotericin B. The nurse understands that this medication treats. Here are the options. Option A. Autoimmune infections. Option B. Fungal infections. Option C. Viral infections. Option D. Bacterial infections. The correct answer is option B, fungal infections. Correct answer, fungal infections. Amphotericin B is a powerful antifungal indicated in treating systemic fungal infections. This medication requires premedication with isotonic saline, diphenhydramine, and acetaminophen to help decrease the symptoms of fever, chills, and rigors associated with the infusion. Question 31. The nurse, while on duty in an adult cardiac telemetry unit, encounters the following rhythms on the monitor. Which of the following clients should the nurse promptly attend to and immediately notify the RN about? Here are the options. Option A. The correct answer is option A. Correct answer, A. A complete heart block may lead to fatal symptomatic bradycardia with a heart rate of less than 40/min, hypotension, seizures, cerebral ischemia, cardiac arrest, or sudden cardiac death. Therefore, it is considered a fatal rhythm, and hence, this client is a top priority. This electrocardiogram ECG shows A, otherwise known as a complete heart block. This rhythm is fatal without intervention. If you notice this, you must notify the RN immediately so appropriate interventions can be implemented. Question 32. What is the nurse's priority when a fire occurs in a client's room? Here are the options. Option A. Rescue the client. Option B. Extinguish the fire. Option C. Sound the alarm. Option D. Run for help. The correct answer is option A. Rescue the client. Correct answer. Rescue the client. Client safety is always the priority. Question 33. The nurse has attended a staff education program about disseminated intravascular coagulation (DIC). Which of the following clients is at risk for DIC? A client. Here are the options. Option A with iron deficiency anemia receiving parenteral iron sucrose infusion. Option B being treated for gram-negative sepsis with intravenous antibiotics. Option C with atrial fibrillation receiving prescribed rivaroxaban to reduce the risk for stroke. Option D taking a daily aspirin to reduce their risk for acute coronary syndrome. The correct answer is option B. Being treated for gram-negative sepsis with intravenous antibiotics. Correct answer, being treated for gram-negative sepsis with intravenous antibiotics. A client with gram-negative sepsis faces an array of complications, including DIC. The release of the endotoxin by the bacteria may cause excessive activation of the clotting cascade, leading to exhaustion by the clotting factors. Clients with sepsis need to be monitored for DIC as this condition is life-threatening. The risk for DIC caused by gram-negative sepsis is even higher for those with hypothermia and acidosis because the coagulation factors' enzymatic functions are pH and temperature dependent. Question 34. The LPN is providing care to a client with a tracheostomy tube and notes the client's respiratory rate and heart rate increase during suctioning. Which of the following actions are appropriate for the nurse to take? Select all that apply. Choices: notify the RN, hurry up and finish the suctioning, check the oxygen saturation, call a rapid response. Here are the options. Option A. Notify the RN, stop suctioning, check the oxygen saturation. The correct answer is option A. Notify the RN, stop suctioning, check the oxygen saturation. Correct answer. Notify the RN, stop suctioning, check the oxygen saturation. The LPN should stop the suctioning, check the oxygen saturation and notify the RN immediately. Question 35. A practical nurse cares for an elderly client, reflecting on their life experiences and achievements. Which of the following statements reflects the concept of ego integrity? Select all that apply. Choices. The individual experiences a sense of fulfillment and satisfaction with life. The individual feels regret and dissatisfaction with life choices. The individual reflects positively on past accomplishments and life experiences. The individual feels confused and uncertain about their life's purpose. Here are the options. Option A. The individual experiences a sense of fulfillment and satisfaction with life. The individual reflects positively on past accomplishments and life experiences. The correct answer is option A. The individual experiences a sense of fulfillment and satisfaction with life. The individual reflects positively on past accomplishments and life experiences. Correct answer. The individual experiences a sense of fulfillment and satisfaction with life. The individual reflects positively on past accomplishments and life experiences. This statement accurately reflects ego integrity as it describes fulfillment and satisfaction with life. Question 36. When performing skin assessments on clients, nurses must pay attention to cleanliness, color, temperature, texture, moisture, sensation, vascularity, and lesions. Which guidelines should the nurse follow when performing these assessments? Select all that apply. Choices. Compare bilateral body parts for symmetry. Proceed in a toe-to-head systematic manner. Use standard terminology to report and record findings. Do not allow data from the nursing history to direct the assessment. Here are the options. Option A. Compare bilateral body parts for symmetry. Use standard terminology to report and record findings. Perform the appropriate skin assessment when risk factors are identified. The correct answer is option A. Compare bilateral body parts for symmetry. Use standard terminology to report and record findings. Perform the appropriate skin assessment when risk factors are identified. Correct answer. Compare bilateral body parts for symmetry. Use standard terminology to report and record findings. Perform the appropriate skin assessment when risk factors are identified. Question 37. The LPN is conducting a health screening at a local health fair. Which of the following should the LPN recognize as a risk factor for developing type Roman II diabetes mellitus? Select all that apply. Choices. Gestational diabetes, metabolic syndrome, chronic corticosteroid use, gastric bypass surgery, obesity. Here are the options. Option A. Gestational diabetes, metabolic syndrome, chronic corticosteroid use. The correct answer is option A. Gestational diabetes, metabolic syndrome, chronic corticosteroid use. Correct answer. Gestational diabetes, metabolic syndrome, chronic corticosteroid use. Obesity. Question 38. The nurse is assessing an infant who is 9 months old. Which of the following would be an expected age-related finding? Select all that apply. Choices. Sitting without support, standing without support, taking their first steps, walks unsupported, rolling over. Here are the options. Option A. Sitting without support, rolling over. The correct answer is option A. Sitting without support, rolling over. Correct answer. Sitting without support, rolling over. Sitting without support is a gross motor skill that should be developed by 8 to 9 months. Indeed, a 9-month-old infant should already be able to sit up without support. If they have not yet met this milestone by 9 months of age, follow-up is warranted to evaluate the infant further. They may miss other milestones and need help, such as physical therapy. Rolling over is a milestone that should be developed in a 9-month-old infant. Rolling completely over should be accomplished by the time the infant is 6 months old. If they have not met this milestone by 9 months of age, follow-up is warranted to evaluate the infant further. They may miss other milestones and need help, such as physical therapy. Question 39. The nurse is caring for a client with hypertension. Which of the following lifestyle modifications are recommended for managing hypertension? Select all that apply. Choices: isometric exercises, smoking cessation, use of herbal supplements, weight loss, decreasing sodium intake. Here are the options. Option A: isometric exercises, decreasing sodium intake, smoking cessation. The correct answer is option A: isometric exercises, decreasing sodium intake, smoking cessation. Correct answer: isometric exercises, decreasing sodium intake, smoking cessation. Question 40. The nurse is reinforcing teaching with the parents of a child diagnosed with eczema. Which of the following information should the nurse include? Select all that apply. Choices: avoid harsh soaps and detergents. Apply lotion immediately after bathing. Baths with hot water are preferred. Wash the affected areas 4-5 times per day. Keep nails short. Here are the options. Option A: avoid harsh soaps and detergents. Apply lotion immediately after bathing. Keep nails short. The correct answer is option A: avoid harsh soaps and detergents. Apply lotion immediately after bathing. Keep nails short. Correct answer: avoid harsh soaps and detergents. Apply lotion immediately after bathing. Keep nails short. Keep nails short. Question 41. Which actions are recommended guidelines when providing foot care for residents in a long-term care facility? Select all that apply. Choices: bathe the feet thoroughly in mild soap and tepid water solution. Soak the feet in warm water and bath oil. Dry feet thoroughly, including the area between the toes. Use an alcohol rub if the feet are dry. Here are the options. Option A: bathe the feet thoroughly in mild soap and tepid water solution. Dry feet thoroughly, including the area between the toes. Use an antifungal foot powder if necessary to prevent fungal infections. The correct answer is option A: bathe the feet thoroughly in mild soap and tepid water solution. Dry feet thoroughly, including the area between the toes. Use an antifungal foot powder if necessary to prevent fungal infections. Correct answer: bathe the feet thoroughly in mild soap and tepid water solution. Dry feet thoroughly, including the area between the toes. Use an antifungal foot powder if necessary to prevent fungal infections. Question 42. The nurse is caring for a client who sustained a stroke impacting the occipital lobe. Which of the following findings would support this diagnosis? Here are the options. Option A: homonymous hemianopia. Option B: impaired proprioception. Option C: expressive aphasia. Option D: impulsivity. The correct answer is option A: homonymous hemianopia. Correct answer: homonymous hemianopia. Visual disturbances are expected for a client with a stroke impacting the occipital lobe of the brain. The occipital lobe is the primary optical center of the brain. Homonymous hemianopia is a complete left or right visual field defect. The client may need to be taught to scan the room, and the nurse should place objects in the unaffected visual field. Question 43. The nurse is caring for a client receiving intermittent bolus tube feeds. The nurse prepares to begin the next feed and aspirates 85 ml of residual from the nasogastric tube. Which of the following actions are appropriate? Select all that apply. Choices: document the color, odor, consistency, and amount of the residual. Hold the next feeding. Send the residual to the lab. Administer the residual back to the client. Here are the options. Option A. Document the color, odor, consistency, and amount of the residual. Administer the residual back to the client. The correct answer is option A. Document the color, odor, consistency, and amount of the residual. Administer the residual back to the client. Correct answer: document the color, odor, consistency, and amount of the residual. Administer the residual back to the client. This is the appropriate documentation for any fluids that the nurse observes from the client. You can remember this documentation from the mnemonic COCA: Aller, door, consistency, and mount. For example, in this situation, it may be tan, formula-like residual, non-odorous, thick 85 ml. This documentation will help identify what is normal for the client and when there are any issues. Question 44. The nurse is caring for a newborn. Which of the following actions would be appropriate for the nurse to take? Here are the options. Option A. Perform UPGAR assessment at 5 and 10 minutes. Option B. Suctions the nose then the mouth. Option C. Administer RO-GAM intramuscularly. Option D. Obtain the first outfit from the warmer. The correct answer is option D. Obtain the first outfit from the warmer. Correct answer: obtain the first outfit from the warmer. A newborn is at risk of cold stress during the first few hours of post-intrauterine life. To prevent cold stress, the nurse should place the newborn skin to skin with a parent, obtain the first outfit out of a warmer, and dry the newborn thoroughly. Question 45. Which of the following statements made by a TB client being prepared for discharge indicate his understanding of the education provided? Select all that apply. Choices: everyone in my family needs to go and see the doctor for TB testing. I will continue to take the isoniazid until I am feeling completely well. I will cover my mouth and nose when I sneeze or cough and put my used tissues in a plastic bag. I will change my diet to include more foods rich in iron, protein, and vitamin C. Here are the options. Option A. Everyone in my family needs to go and see the doctor for TB testing. I will cover my mouth and nose when I sneeze or cough and put my used tissues in a plastic bag. I will change my diet to include more foods rich in iron, protein, and vitamin C. The correct answer is option A. Everyone in my family needs to go and see the doctor for TB testing. I will cover my mouth and nose when I sneeze or cough and put my used tissues in a plastic bag. I will change my diet to include more foods rich in iron, protein, and vitamin C. Correct answer: everyone in my family needs to go and see the doctor for TB testing. I will cover my mouth and nose when I sneeze or cough and put my used tissues in a plastic bag. I will change my diet to include more foods rich in iron, protein, and vitamin C. Question 46. Which of the following best describes an appropriate outcome for a 75-year-old client with a history of Huntington's disease who has developed contractures? Here are the options. Option A. The client will monitor for signs of skin breakdown as a result of the contractures. Option B. The client will learn to reposition himself in his bed and chair without assistance. Option C. The client will participate in a range of motion exercises to reduce the effects of contractures. Option D. The client will verbalize the effects of contractures on activities of daily living. The correct answer is option C. The client will participate in a range of motion exercises to reduce the effects of contractures. Correct answer. The client will participate in a range of motion exercises to reduce the effects of contractures. Performing range of motion exercises will help decrease the risk of further atrophy and should be encouraged. Huntington's disease is a progressive condition that can lead to muscle atrophy and potential contractures. The client in this situation should be given a program with range of motion exercises. The nurse can help the client to increase his range of motion and prevent worsening of contractures by improving flexibility and reducing rigidity. Question 47. Which action would be the most appropriate for a nurse to use as an alternative to restraints for an elderly client who is disoriented and tends to wander the halls of his long-term care facility? Here are the options. Option A. Sit the client in a geriatric chair near the nurse's station. Option B. Use bedsheets to secure the client snugly in bed. Option C. Keep the client's bed in a high position so he doesn't get out. Option D. Put the client's picture and a balloon on his door so he knows which room is his. The correct answer is option D. Put the client's picture and a balloon on his door so he knows which room is his. Correct answer. Put the client's picture and a balloon on his door so he knows which room is his. Identifying the client's door with his picture and a balloon may be a helpful alternative to restraints. Question 48. The licensed practical/vocational nurse LPN/VN reinforces teaching to a client prescribed tamsulosin. Which of the following statements should the nurse include? Here are the options. Option A. This medication may turn your urine reddish/orange. Option B. You will urinate more often with this medication. Option C. Change position slowly while you take this medication. Option D. Avoid calcium-containing foods while on this medication. The correct answer is option C. Change position slowly while you take this medication. Correct answer. Change position slowly while you take this medication. Tamsulosin is an alpha-1 antagonist medication indicated in the treatment of benign prostatic hypertrophy. This medication causes vasodilation, and orthostatic hypotension is the most significant side effect. The nurse should educate the client to change positions slowly while taking this medication to reduce the risk of orthostasis. Question 49. The nurse detects an elevated temperature in a client who is scheduled for surgery. The client has been febrile and has no other symptoms of fever. What should be the first nursing action? Here are the options. Option A. Inform the charge nurse. Option B. Inform the surgeon. Option C. Validate the finding. Option D. Document the finding. The correct answer is option C. Validate the finding. Correct answer. Validate the finding. The nurse should first validate the finding if it is unusual, deviates from normal, and is unsupported by other data. Question 50. The licensed practical/vocational nurse LPN/VN collects data on a client who has overdosed on aspirin. Which clinical finding would be most concerning? Here are the options. Option A, pulmonary edema. Option B, tinnitus. Option C, nausea and vomiting. Option D, tachycardia. The correct answer is option A, pulmonary edema. Correct answer. Pulmonary edema. All of these manifestations are associated with an aspirin overdose. Pulmonary edema is the most concerning and is caused by a lung injury induced by aspirin. A treatment for aspirin overdose is an infusion of sodium bicarbonate to correct metabolic acidosis. During the infusion, the nurse must be sensitive to the potential lung injury caused by aspirin. Thus, auscultating lung sounds and assessing for pulmonary edema will be essential. Manifestations of pulmonary edema include tachypnea, tachycardia, and crackles in the lung fields. Question 51. The nurse evaluates a student's ability to remove personal protective equipment (PPE) appropriately. It would indicate effective teaching if the student removes the PPE in which order? Place the steps in the appropriate order. Here are the options. Option A, gloves, goggles, gown. The correct answer is option A, gloves, goggles, gown. Correct answer, gloves, goggles, gown. Question 52. Which of the following clients would be most appropriate to assign to the LPN? Select all that apply. Choices: a client receiving antibiotics for lower extremity cellulitis. A client newly admitted with an exacerbation of myasthenia gravis. A client with a chest tube receiving mechanical ventilation. A client requiring a referral for an outpatient support group. Here are the options. Option A, a client receiving antibiotics for lower extremity cellulitis. A patient needing scheduled tube feedings and colostomy irrigations. The correct answer is option A, a client receiving antibiotics for lower extremity cellulitis. A patient needing scheduled tube feedings and colostomy irrigations. Correct answer, a client receiving antibiotics for lower extremity cellulitis. A patient needing scheduled tube feedings and colostomy irrigations. When making client assignments, the LPN should be assigned to the stable client with a predictable outcome. A client receiving antibiotics for lower extremity cellulitis is a low-acuity illness and may be cared for by the LPN. Scheduled tube feedings and colostomy irrigations are within the scope of an LPN, and this can be delegated. Question 53. The nurse is caring for a client with the following tracing on the electrocardiogram. When reviewing the client's medical history, which condition could be causing this dysrhythmia? See the image below. Select all that apply. Choices: hyperthyroidism, hypothyroidism, increased intracranial pressure, severe hypothermia, shock. Here are the options. Option A, hyperthyroidism, shock. The correct answer is option A, hyperthyroidism, shock. Correct answer, hyperthyroidism, shock. The tracing shows sinus tachycardia. Sinus tachycardia may be caused by various conditions, including febrile illness, dehydration, shock, anemia, and hyperthyroidism. Sinus tachycardia is a heart rate greater than 100 beats per minute, as a P wave before each QRS complex, and is regular. The treatment of ST is the underlying cause. For example, if the client is febrile, the treatment would be prescribed fluids and antipyretics acetaminophen. Question 54. Which of the following statements by a patient who has recently been in a cast on the right lower extremity would be the most alarming to the nurse? Here are the options. Option A: I've been having pain in my right calf. Option B: my right leg feels really itchy. Option C: I didn't keep my leg elevated as the doctor asked me to. Option D: when I put weight on my crutches, it makes arthritis in my wrists worse. The correct answer is option A. I've been having pain in my right calf. Correct answer: I've been having pain in my right calf. Pain in the casted extremity could indicate neurovascular compromise. Patients who have been in a cast should be educated on safety measures and signs of complications before discharge from care. It is not uncommon for the skin inside a cast to itch. However, any signs of neurovascular compromise should be immediately reported. If a patient reports pain in a casted extremity, this is a sign of compromise and requires immediate assessment/intervention. Patients should be instructed to report pain, tingling, edema in the extremity that is greater than before the cast was applied or if the cast feels too loose. Question 55. When discussing the Denver Roman II with a preschooler's parents, which of these statements would indicate that they correctly understood the teaching? Here are the options. Option A: this test will tell me whether or not my child's IQ is normal. Option B: this test will tell me what developmental tasks my child can do today. Option C: this test will measure my child's development. Option D: this will let me know if my child's development is normal or not. The correct answer is option C. This test will measure my child's development. Correct answer: this test will measure my child's development. The Denver Developmental Screening Test (DDSD) was devised to provide a simple method of screening for evidence of slow development in infants and preschool children. The test covers 4 functions: gross motor, language, fine motor adaptive, and personal social. It has been standardized on 1,036 presumably healthy children 2 weeks to 6 years of age whose families reflect the occupational and ethnic characteristics of Denver's population. Question 56. When looking for trends in a postoperative client's vital signs, which documents would the nurse review first? Here are the options. Option A: admission sheet. Option B: admission nursing assessment. Option C: activity flow sheet. Option D: graphic record. The correct answer is option D, graphic record. Correct answer: graphic record. The graphic record should be reviewed first. The graphic record is a document that displays the client's vital signs data over a specific period. The graphical representation allows for easy visualization of any patterns or fluctuations in the vital signs, which could indicate improvement, stability, or potential signs of complications. Question 57. The licensed practical/vocational nurse LPN/VN cares for the assigned clients. Which of the following clients would be appropriate for the nurse to recommend to the registered nurse RN for a referral for an interdisciplinary conference? Select all that apply. Choices: pulmonary tuberculosis with multiple prescriptions and ischemic stroke who has left-sided hemiplegia hyperthyroidism and is scheduled for a thyroidectomy stage 1 Alzheimer's disease who lives with family of fractured tibia and fibula and is homeless. Here are the options. Option A: an ischemic stroke who has left-sided hemiplegia, a fractured tibia and fibula and is homeless. The correct answer is option A, an ischemic stroke who has left-sided hemiplegia, a fractured tibia and fibula and is homeless. Correct answer: an ischemic stroke who has left-sided hemiplegia, a fractured tibia and fibula, and is homeless. A client with hemiplegia will require interdisciplinary care such as occupational and physical therapy. Further, the client may require subacute rehabilitation provided by nursing. A client with fractured tibia and fibula will require physical therapy and social services consultation to assist the client with housing. Question 58. The nurse is caring for a client who sustained a fractured tibia and fibula and has a cast applied to the extremity. Which of the following findings would indicate the client has developed compartment syndrome? Here are the options. Option A: the development of petechiae over the chest. Option B: a new onset of dyspnea and chest pain. Option C: severe pain that is unrelieved by an opioid analgesic. Option D: localized bone pain with a fever. The correct answer is option C: severe pain that is unrelieved by an opioid analgesic. Correct answer: severe pain that is unrelieved by an opioid analgesic. Early manifestations associated with including paresthesia of the affected extremity and pain unrelieved by a prescribed opioid analgesic. Question 59. A nurse is caring for a client with a history of seizures who is at risk for injury. Which intervention is the highest priority to reduce the client's risk of injury? Here are the options. Option A: keeping the client's room dimly lit to minimize visual stimulation. Option B: administer anti-epileptic medications as prescribed. Option C: implement seizure precautions, including padded side rails up and the bed in the lowest position. Option D: provide education to the client and family about seizure triggers and safety measures. The correct answer is option C: implement seizure precautions, including padded side rails up and the bed in the lowest position. Correct answer: implement seizure precautions, including padded side rails up and the bed in the lowest position. Seizures pose a significant risk of injury, and implementing seizure precautions helps to create a safe environment for the client during a seizure episode. Side rails up and padded, as well as the bed in the lowest position, prevent the client from falling out of bed or injuring themselves on nearby furniture. These precautions can minimize the potential for head injuries, fractures, and other injuries associated with seizures. Other precautions might include ensuring that oxygen and suctioning equipment with an airway are readily available. If the client does not have Roman IV access, insert a saline lock, especially if he or she is at significant risk for generalized tonic-clonic seizures. The saline lock provides ready access if Roman IV drug therapy must be given to stop the seizure. Specific seizure precautions vary, depending on healthcare agency policy. Question 60. Diabetes insipidus is a potential complication of which of the following procedures? Here are the options. Option A: surgical removal of the pituitary gland. Option B: reduction of mass on the thyroid gland. Option C: hysterectomy. Option D: dilation and curettage. The correct answer is option A: surgical removal of the pituitary gland. Correct answer: surgical removal of the pituitary gland. Damage to the pituitary gland or hypothalamus from surgery increases the risk for diabetes insipidus. This is because the posterior pituitary is the gland that regulates the production, storage, and release of antidiuretic hormone ADH. A decreased amount of ADH results in diabetes insipidus. Question 61. Which of the following infection control activities should be delegated to an experienced nursing assistant? Here are the options. Option A. Asking clients about the duration of antibiotic therapy. Option B. Demonstrating correct hand washing techniques to the client and family. Option C. Disinfecting blood pressure cuffs after clients are discharged. Option D. Screening clients for upper respiratory tract symptoms. The correct answer is option C. Disinfecting blood pressure cuffs after clients are discharged. Correct answer: disinfecting blood pressure cuffs after clients are discharged. Nursing assistants can follow agency protocol to disinfect items that come in contact with intact skin by cleaning with chemicals such as alcohol. Nurses must know their own scope of practice and the scope of practice of the UAP, which may vary depending on a facility's policies and procedures. Thus, the nurse must know the employer's policies and procedures for delegation, the UAP's job description, and the UAP's skill level. Question 62. The nurse in the emergency department ED is caring for a client with heat stroke. Which prescription should the nurse anticipate from the primary healthcare provider PHCP? Here are the options. Option A. Acetaminophen. Option B. Naproxen. Option C. Ketorolac. Option D. 0.9% saline. The correct answer is option D. 0.9% saline. Correct answer: 0.9% saline. 0.9% saline infusion is necessary to administer to a client with heat stroke because this condition induces a significant fluid deficit. Additionally, 0.9% saline may be cooled to provide an adjunctive cooling measure. Question 63. The nurse is triaging phone calls at a clinic. The nurse should initially follow up with the client who reports. Here are the options. Option A: decreased libido while receiving prescribed dutasteride. Option B: swelling in their right leg while receiving prescribed tamoxifen. Option C: hot flashes and night sweats while receiving prescribed letrozole. Option D: bone pain while receiving prescribed filgrastim. The correct answer is option B. Swelling in the right leg while receiving prescribed tamoxifen. Correct answer: swelling in their right leg while receiving prescribed tamoxifen. Tamoxifen is a hormone antagonist. Specifically, it is an estrogen antagonist that prevents hormone receptor-positive breast cancer. For an unclear reason, tamoxifen increases the likelihood of adverse clotting events such as deep vein thrombosis (DVT) and venous thromboembolism or PE. If DVT is not quickly diagnosed and treated, the client may develop a PE that can be life-threatening. A client taking tamoxifen who experiences manifestations of DVT leg pain, edema, or PE dyspnea, chest pain should report these symptoms. Question 64. When an elderly home health client suddenly develops delirium, what is the first thing the home health nurse should assess for? Here are the options. Option A: drug intoxication. Option B: increased hearing loss. Option C: cancer metastasis. Option D: congestive heart failure. The correct answer is option A. Drug intoxication. Correct answer: drug intoxication. Drug intoxication, from prescription or over-the-counter medications, is more common in the elderly due to slower metabolism and absorption. Combinations of digoxin, diuretics, analgesics, and anticholinergics should be examined. Delirium is an acute and reversible syndrome. It is characterized by changes in memory, judgment, language, mathematical calculation, abstract reasoning, and problem-solving ability. The most common causes of delirium are infection, medications, and dehydration. Question 65. When collecting data about a client's pain, the first step in pain assessment is for the nurse to. Here are the options. Option A. Accept the client's report of pain. Option B. Get the description of the location and intensity of the pain. Option C. Have the client identify coping methods. Option D. Determine the client's status of pain. The correct answer is option A. Accept the client's report of pain. Correct answer. Accept the client's report of pain. Assessment of pain is a vital part of any nursing assessment. In fact, pain is often called the fifth vital sign. If a client does not immediately report pain, it is still the nurse's responsibility to ask if he/she feels any pain. If the client reports pain under any circumstance, the nurse should validate the client's concern by acknowledging he/she is feeling discomfort and then assess more thoroughly to find out the location and intensity, identify coping mechanisms, and follow up with their pain status. Question 66. Which of the following client room assignments should the nurse question? Here are the options. Option A. Placement of an 89-year-old client with acute delirium at the end of the hallway. Option B. Placement of a 79-year-old client with C. difficile with a 26-year-old client with C. difficile. Option C. Placement of a 56-year-old client with HIV and bronchitis in a private room. Option D. Placement of a 39-year-old client with mild head trauma with a 40-year-old client with an arm fracture. The correct answer is option A. Placement of an 89-year-old client with acute delirium at the end of the hallway. Correct answer. Placement of an 89-year-old client with acute delirium at the end of the hallway. Clients with delirium and those at high risk for safety events should be roomed close to the nurse's station to accommodate close monitoring. In addition to the delirium, this client's age poses a risk for injury related to falls. Question 67. The nurse knows it is important to monitor a client's use of complementary and alternative medicine CAM because? Here are the options. Option A. Clients should be warned that most CAM therapies are potentially dangerous. Option B. Additional treatment may not be needed if the client is using CAM. Option C. CAM therapy could interact with prescription and over-the-counter medications. Option D. Most CAM therapies are essentially ineffective. The correct answer is option C. CAM therapy could interact with prescription and over-the-counter medications. Correct answer. CAM therapy could interact with prescription and over-the-counter medications. One key concept to remember when dealing with alternative therapies is that natural does not always mean better or safe. Some herbal products contain ingredients that may interact with prescription drugs. For example, clients taking medications with potentially dangerous adverse effects, such as insulin, warfarin, or digoxin, should be warned to never take dietary supplements without first discussing their needs with a physician. Complementary and alternative medicine CAM comprises an incredibly diverse set of therapies and healing systems. CAM is considered to be outside the mainstream of healthcare. From a therapeutic perspective, much of the value of CAM therapies is their ability to reduce medication needs. Question 68. The nurse is visiting the home of a client with. Which infection control measure should the nurse include? Here are the options. Option A. Ask the client to wear a surgical mask during the visit. Option B. Obtain vital signs with a disposable blood pressure cuff. Option C. Interview the client while maintaining 3 feet distance. Option D. Use sterile gloves when performing venipuncture. The correct answer is option B. Obtain vital signs with a disposable blood pressure cuff. Correct answer. Obtain vital signs with a disposable blood pressure cuff is a spore-producing bacterium that allows it to be transmitted between clients, environmental surfaces, and contaminated hands. Obtaining vital signs with disposable equipment is recommended to prevent the transmission of this pathogen. Question 69. Which of the following would be a priority action for a nurse who sustained a needle stick injury while working with an AIDS client? Here are the options. Option A. Contact a social worker right away. Option B. Start prophylactic ACT. Option C. Start prophylactic pentamidine treatment. Option D. Make an appointment with a psychiatrist. The correct answer is option B. Start prophylactic ACT. Correct answer. Start prophylactic AZT. AZT-zidovudine is the most critical intervention. It is an antiretroviral medication used to prevent and treat HIV/AIDS by reducing the virus's replication. Question 70. Which stage of psychosocial development does the nurse know a 2-month-old infant will be in? Here are the options. Option A. Initiative versus guilt. Option B. Autonomy versus shame and self-doubt. Option C. Trust versus mistrust. Option D. Industry versus inferiority. The correct answer is option C. Trust versus mistrust. Correct answer. Trust versus mistrust. Trust versus mistrust is the typical development stage for infancy, which lasts from birth to 18 months. This is the stage the nurse would expect for her 2-month-old client. In this stage, children develop a sense of trust when caregivers provide reliability, care, and affection. When infants do not have that, they will develop mistrust. Question 71. The nurse is caring for a client that is scheduled to have a thyroidectomy. The nurse understands that the primary reason for giving potassium iodide and iodine solution to this client preoperatively is, here are the options. Option A. Decrease the risk of agranulocytosis postoperatively. Option B. Prevent tetany while the client is under general anesthesia. Option C. Reduce the size and vascularity of the thyroid and prevent hemorrhage. Option D. Potentiate the other preoperative medications effect so less medicine can be used while the client is under anesthesia. The correct answer is option C. Reduce the size and vascularity of the thyroid and prevent hemorrhage. Correct answer. Reduce the size and vascularity of the thyroid and prevent hemorrhage. It serves to reduce the size and vascularity of the thyroid gland, thereby preventing hemorrhage. Hyperthyroidism is associated with hemodynamic variations, including increased heart rate and cardiac contractility, as well as decreased peripheral resistance due to excess serum thyroid hormones. Adequate preoperative preparation of the client is crucial to avoid intraoperative or postoperative complications and decrease the gland's vascularity. While complications are rare in the hands of experienced surgeons, even a small amount of intraoperative bleeding can compromise the visualization and preservation of surrounding nerves, vasculature, and parathyroid glands. Therefore, The administration of potassium iodide and iodine solution preoperatively has been a practice to limit intraoperative bleeding and associated complications resulting from thyroid gland vascularization. Question 72. The nurse working in the emergency department triages a 29-year-old who states, "I am going to kill myself. They are coming for me." Which of the following responses utilizes therapeutic communication? Here are the options. Option A. You are safe here. Can you tell me more about what is happening? Option B. Please don't try to kill yourself. We will sedate you if we have to. Option C. Why would you kill yourself? Option D. Who is coming for you? The correct answer is option A. You are safe here. Can you tell me more about what is happening? Correct answer. You are safe here. Can you tell me more about what is happening? This statement uses therapeutic communication by helping the client feel safe and asking open-ended questions to gather more information. Question 73. The nurse is discussing varicose veins and at-home management with a group of clients. Which of the following should the nurse reinforce in the teaching session? Here are the options. Option A. When you are sitting, keep your legs lower than your heart. Option B. Wear compression stockings during the day. Option C. Participate in activities that have you stand for long periods. Option D. Take a low-dose aspirin to prevent the development of new varicose veins. The correct answer is option B. Wear compression stockings during the day. Correct answer. Wear compression stockings during the day. Compression stockings/hoses are effective because the external pressure promotes venous return. Compression hose combined with frequent position changes, daily walks, frequent position changes, and keeping the legs elevated to facilitate venous return is recommended. Question 74. You are caring for an elderly woman who is practicing Orthodox Judaism. Which meal would you most likely offer this client? Here are the options. Option A. Cottage cheese and fruit. Option B. Beef lasagna. Option C. Hamburger and milk. Option D. Pork cutlet parmigiana. The correct answer is option A. Cottage cheese and fruit. Correct answer. Cottage cheese and fruit. You would offer this client a meal consisting of cottage cheese and fruit because Orthodox Jewish people are not permitted to have dairy products and meat in one meal. Question 75. Which of the following meals would be appropriate for a nurse to assign to a client of Orthodox Judaism faith on a kosher diet? Here are the options. Option A. Pork belly roast, rice, vegetables, mixed fruit, milk. Option B. Crab salad on a croissant, potato salad, milk, vegetables with dip. Option C. Sweet and sour chicken with rice and vegetables, juice, mixed fruits. Option D. Fettuccine Alfredo with shrimp and vegetables, salad, mixed fruit, iced milk tea. The correct answer is option C. Sweet and sour chicken with rice and vegetables, juice, mixed fruits. Correct answer. Sweet and sour chicken with rice and vegetables, juice, mixed fruits. Believers adhere to kosher dietary laws. For this group, these are allowed. Other meats that are allowed include. Question 76. The nurse is assisting a client of the Orthodox Jewish faith while serving lunch. A kosher meal has been delivered to the client. What is the next appropriate action to perform with this client? Here are the options. Option A. Substitute plastic utensils with metal utensils. Option B. Unwrap the eating utensils for the client. Option C. Carefully transfer the food from a styrofoam tray to a ceramic plate. Option D. Allow the client to unwrap the utensils and prepare their own meal. The correct answer is option D. Allow the client to unwrap the utensils and prepare their own meal. Correct answer. Allow the client to unwrap the utensils and prepare their own meal. A person of the Orthodox faith should be able to unwrap the utensils and prepare their own meal. Question 77. A nurse is preparing the plan of care for a client with stage 2 ovarian cancer who is a Jehovah's Witness. The client has been told that surgery is necessary. Taking into consideration the client's religious preferences in developing the plan of care, the nurse documents which of the following? Here are the options. Option A. Religious sacraments and traditions are unimportant. Option B. Medication administration is not allowed for this group. Option C. Surgery is strictly prohibited in this religious group. Option D. Blood transfusion or the administration of blood and blood products is forbidden for this group. The correct answer is option D. Blood transfusion or the administration of blood and blood products is forbidden for this group. Correct answer. Blood transfusion or the administration of blood and blood products is forbidden for this group. For Jehovah's Witnesses, surgery is allowed, but the administration of blood and blood products is forbidden. Question 78. The nurse is collecting data on a client newly admitted to the medical surgical unit. Which question would be appropriate for the nurse to ask regarding the client's spirituality? Here are the options. Option A. What are your sources of hope and strength? Option B. Have you considered arranging a visit from members of your church? Option C. Do you attend worship any specific day of the week? Option D. Can you tell me about your dietary preferences and any restrictions? The correct answer is option A. What are your sources of hope and strength? Correct answer. What are your sources of hope and strength? Spirituality and religion are not synonymous. Spirituality refers to an interpretation of a client's beliefs regarding their own wood or spirit and a connection bigger than oneself. Spirituality is fluid and often evolves. Religion is structured and may have a specific god or gods. Religion is often ritualistic and may involve readings from a well-regarded book or text. Spirituality is fluid and is purely internal to one's ability to feel connected and look inside for hope and strength. Religion often looks to an external source, such as the Bible, for guidance. This question is appropriate to ask the client to inquire about their spirituality. Question 79. The nurse has attended a staff conference on cultural considerations. Which of the following statements would be correct regarding the Amish culture? Select all that apply. Choices. Natural and alternative treatments are common in the community. Church is extremely important in this community. Women and men are equal and can both make healthcare decisions. Most of the Amish community choose to have health insurance. Blood and blood products are commonly declined. Here are the options. Option A. Natural and alternative treatments are common in the community. Church is extremely important in this community. The correct answer is option A. Natural and alternative treatments are common in the community. Church is extremely important in this community. Correct answer. Natural and alternative treatments are common in the community. Church is extremely important in this community. Alternative medical choices and natural treatments are commonly used in this culture. The nurse should recognize this fact because standard therapies may be abandoned for treatments that may be unproven. Church and religion are fundamental in this community. If an individual in the community is ill, it is common for a religious leader to request updates about the client's condition. Question 80. The licensed practical/vocational LPN/VN assists a registered nurse RN in planning a community health course about preventing Lyme disease. Which of the following information should be included? Here are the options. Option A. You should try limiting your outdoor activities between 10 a.m. and 4 p.m. Option B. Wear sunglasses that wrap around and block UVA and UVB rays. Option C. Wear long-sleeved clothing when in heavily wooded areas. Option D. Apply sunscreen with at least an SPF of 30. The correct answer is option C. Wear long-sleeved clothing when in heavily wooded areas. Correct answer. Wear long-sleeved clothing when in heavily wooded areas. Lyme disease is spread by a deer tick commonly found in heavily wooded areas. Wearing long-sleeved clothing, applying tick repellent, and showering after hikes in the woods is an effective strategy in preventing being bitten by a tick and further infected with the bacteria. Question 81. A nurse has received a telephone prescription from the primary healthcare provider PHCP for citalopram 10 mg/PO daily. Which action is the nurse's priority after taking the telephone order? Choices. Verify that the medication is in stock, inform the client of the new prescription, read back the prescription to the PHCP, transmit the prescription to the pharmacy. Here are the options. Option A. Read back the prescription to the PHCP. The correct answer is option A. Read back the prescription to the PHCP. Correct answer. Read back the prescription to the PHCP. It is that the nurse read back the order to the PHCP to ensure that the prescription telephone order is accurate. Any verbal or telephone order from a PHCP requires the nurse back the order to verify that the order was accurate. Telephone and verbal orders may result in medication errors because of accents, background noise, etc. that may distort communication. Question 82. Which advice is most appropriate for a client on nootropic precautions who wants to learn ways to prevent infection? Here are the options. Option A. Only brush your teeth once a day or every other day. Option B. Avoid the use of tampons for menstrual periods. Option C. Do not let visitors within 10 feet. Option D. Wash hands after handling pets. The correct answer is option B. Avoid the use of tampons for menstrual periods. Correct answer. Avoid the use of tampons for menstrual periods. Tampons may cause tears in the vagina that could lead to infection. Tampons can introduce harmful bacteria into the vaginal canal, especially during insertion and removal. This risk is significant for nootropic clients, as their weakened immune system may not be able to fight off infections effectively. Question 83. The nurse is precepting a new nurse who collects a swab specimen from an open wound of a client with suspected Pseudomonas infection. Which action requires immediate intervention by the nurse? Here are the options. Option A. The nurse flushes the wound with sterile saline. Option B. After inserting the swab, the nurse squeezes the culture tube. Option C. The nurse collects purulent drainage from the deepest part of the wound. Option D. The nurse uses a rayon swab to collect the specimen. The correct answer is option C. The nurse collects purulent drainage from the deepest part of the wound. Correct answer. The nurse collects purulent drainage from the deepest part of the wound. Purulent drainage or pus can give unreliable results and should not be used as the source for the specimen. The nurse should obtain the swab specimen by pressing and rotating the swab in the cleanest, deepest part of the wound. Question 84. What key educational points should the LPN reinforce with the family of a 3-year-old child newly diagnosed with acute lymphoblastic leukemia? All. Select all that apply. Choices. The importance of regular follow-ups for chemotherapy sessions. Monitor for signs of infection due to a weakened immune system. Possibility of hair loss as a side effect of chemotherapy. Need for regular blood tests to monitor the child's health status. Here are the options. Option A. The importance of regular follow-ups for chemotherapy sessions. Monitor for signs of infection due to a weakened immune system. Possibility of hair loss as a side effect of chemotherapy. The correct answer is option A. The importance of regular follow-ups for chemotherapy sessions. Monitor for signs of infection due to a weakened immune system. Possibility of hair loss as a side effect of chemotherapy. Correct answer. The importance of regular follow-ups for chemotherapy sessions. Monitor for signs of infection due to a weakened immune system. Possibility of hair loss as a side effect of chemotherapy. Regular blood tests are necessary to monitor the child's blood cell counts, liver and kidney functions, and response to treatment. It can also help detect any complications at an early stage. Question 85. The nurse is caring for a 4-year-old in respiratory distress. Which of the following complications should the nurse monitor for that frequently occur with respiratory distress? Here are the options. Option A. Ectopy. Option B. Irritability. Option C. Sepsis. Option D. Dehydration. The correct answer is option D. Dehydration. Correct answer. Dehydration. Dehydration is a frequent complication of respiratory distress for which the nurse must know to monitor. Rapid breathing is often seen in children with respiratory distress. Additionally, mouth breathing is common in children due to nasal congestion, edema, and inflammation. As these children exhale more and more frequently, significant and sensible fluid losses occur. Since children with respiratory distress do not take enough fluids by mouth, their intake is rarely enough to keep up with their insensible losses. Therefore, dehydration frequently occurs in a child experiencing respiratory distress. If the child is receiving humidified oxygen, insensible losses from tachypnea are minimal. Otherwise, it's important that the maintenance fluids include an additional 20-50% as a respiratory replacement in a child with tachypnea. Question 86. You are reinforcing counseling for 2 parents that are preparing for the birth of their first child. The mother has sickle cell anemia. So the father has decided to undergo genetic testing to determine if he is a carrier or not. He finds out that he is not a carrier. What is the chance of their baby having sickle cell anemia? Here are the options. Option A. 25%. Option B. 50%. Option C. 75%. Option D. 0%. The correct answer is option D. 0%. Correct answer. 0%. The baby has no chance or 0% chance of having sickle cell anemia. Instead, the baby will be a carrier. Since the mother has the disease, she is SS. Since the father has tested that he is not a carrier, he is SS. This means that the only combination possible for the baby is SS or a carrier. Question 87. The nurse administered prescribed 6 units of regular insulin. Which data collection finding requires follow-up? Here are the options. Option A. rapid labored breathing. Option B, increase appetite. Option C, cold sweats. Option D, increased urination. The correct answer is option C, cold sweats. Correct answer, cold sweats. Regular insulin may be given subcutaneously and peaks within 2 to 4 hours after administration. The peak effects of the medication raise the client's risk for hypoglycemia. Cold sweats are a clinical feature of hypoglycemia. Question 88. The nurse collects data on a client with chronic obstructive pulmonary disease (COPD). Based on the client's vital signs, the nurse should take which action? See the exhibit. Here are the options. Option A, administer acetaminophen in a PAP. Option B, provide the client with warm blankets. Option C, apply oxygen at 2 liters via nasal cannula. Option D, obtain an arterial blood gas (ABG). The correct answer is option A, administer acetaminophen in a PAP. Correct answer, administer acetaminophen in a PAP. The client has a fever, and the treatment for a fever includes fluids and antipyretics such as acetaminophen or ibuprofen. Question 89. You are teaching a community health education session for members of the community with celiac disease. You educate on each of the following foods. What should you teach are okay to eat? Select all that apply. Choices: rice, oats, barley, corn. Here are the options. Option A, rice, corn. The correct answer is option A, rice, corn. Correct answer, rice, corn. Question 90. The nurse is caring for a child with cystic fibrosis at the clinic. The nurse anticipates that the primary healthcare provider PHCP will order which routine laboratory test? Choices: blood glucose, 24-hour urine blood cultures, total cholesterol. Here are the options. Option A, blood glucose. The correct answer is option A, blood glucose. Correct answer, blood glucose. Diabetes mellitus is a common comorbidity associated with cystic fibrosis (CF). The damage that CF may cause to the pancreas may induce diabetes. Thus, random blood glucose levels and quarterly hemoglobin A1C levels are commonly ordered throughout the course of the illness. A random blood glucose level greater than 200 mg/dL may suggest the presence of diabetes. Question 91. The nurse is reinforcing teaching to a client who is taking phenytoin. Which over-the-counter OTC medication should the nurse advise the client to avoid taking at the same time? Here are the options. Option A, acetaminophen. Option B, ibuprofen. Option C, calcium carbonate. Option D, guaifenesin. The correct answer is option C, calcium carbonate. Correct answer, calcium carbonate. Calcium carbonatum should not be taken simultaneously with phenytoin because taking them together can decrease the effects of phenytoin. Antacids containing calcium carbonate reduce the bioavailability of phenytoin by reducing both the rate of absorption and the amount of intake. Phenytoin is an anticonvulsant, therefore not getting a therapeutic dose may result in the client having a recurrent seizure. Clients should be cautioned against the concomitant use of antacids containing calcium carbonate and phenytoin. If the client needs calcium carbonate, he should be instructed to separate the intake of calcium carbonate and phenytoin by at least 2 to 3 hours. Question 92. The nurse is caring for a client experiencing prolonged labor with hypotonic contractions. Which of the following actions should the nurse take? Select all that apply. Choices: encourage frequent voiding. Prepare for a prescribed infusion of oxytocin. Prepare for an infusion of intravenous Roman-4 fluids. Maintain strict bed rest. Here are the options. Option A. Encourage frequent voiding. Prepare for a prescribed infusion of oxytocin. Encourage frequent repositioning. The correct answer is option A. Encourage frequent voiding. Prepare for a prescribed infusion of oxytocin. Encourage frequent repositioning. Correct answer: encourage frequent voiding. Prepare for a prescribed infusion of oxytocin. Encourage frequent repositioning. Maintain strict bed rest. Question 93. The nurse is educating a client about the newly prescribed oxymetazoline nasal spray. It would be appropriate for the nurse to instruct the client to. Here are the options. Option A: sit upright for 30 minutes after taking this medication. Option B: do not use this medication for more than 3 days. Option C: change positions slowly while taking this medication. Option D: rinse your mouth out after taking this medication. The correct answer is option B. Do not use this medication for more than 3 days. Correct answer: do not use this medication for more than 3 days. Oxymetazoline is a nasal spray used to decrease congestion. This medication is administered intranasally and constricts blood vessels in the nasal passage. This medication should not be used for more than 3 days to prevent rebound congestion. Question 94. The nurse at a health fair is talking with a client who is in perimenopause. Which of the following client statements requires follow-up by the nurse? Select all that apply. Choices: I am using oil-based vaginal lubricants to lessen the discomfort during intercourse. My doctor recommended I start taking black cohosh to help with the loss of bone density. I stopped exercising to reduce my hot flashes. I recently started increasing my water intake to help prevent urinary tract infections. Here are the options. Option A: I am using oil-based vaginal lubricants to lessen the discomfort during intercourse. My doctor recommended I start taking black cohosh to help with the loss of bone density. I stopped exercising to reduce my hot flashes. The correct answer is option A. I am using oil-based vaginal lubricants to lessen the discomfort during intercourse. My doctor recommended I start taking black cohosh to help with the loss of bone density. I stopped exercising to reduce my hot flashes. Correct answer: I am using oil-based vaginal lubricants to lessen the discomfort during intercourse. My doctor recommended I start taking black cohosh to help with the loss of bone density. I stopped exercising to reduce my hot flashes. Question 95. A client is being discharged from the hospital after being diagnosed with lupus erythematosus. The client is advised to follow up with what to monitor his condition? Here are the options. Option A: HbA1c. Option B: daily blood pressure checks. Option C: monthly urine specimens. Option D: monthly CBC. The correct answer is option C, monthly urine specimens. Correct answer: monthly urine specimens. Lupus erythematosus, particularly systemic lupus erythematosus, the SLE, can affect various organs including the kidneys. One common complication is lupus nephritis, where the kidneys become inflamed. Monitoring kidney function is crucial for individuals with lupus to detect any signs of kidney involvement and assess disease activity. Regularly checking urine specimens for the presence of protein, blood, or other abnormalities can provide valuable insights into kidney function and lupus-related kidney problems. Question 96. The nurse reviews prescriptions for packed red blood cell PRBC transfusions. Which PRBC transfusion should the nurse question with the primary healthcare provider PHCP? A client. Here are the options. Option A with a febrile illness. Option B with pulmonary edema. Option C receiving mechanical ventilation. Option D with a chest tube for a hemothorax. The correct answer is option B, with pulmonary edema. Correct answer, with pulmonary edema. A unit of PRBC will add fluid volume, and if the client has pulmonary edema, the unit of blood should be questioned with a PHCP until the edema has resolved. Giving a unit of PRBC may worsen pulmonary edema. Clients at risk for transfusion-associated circulatory overload TACO will need to receive their unit of PRBC slower and may require diuretics after the blood has been administered. Question 97. The licensed practical/vocational nurse LPN/VN reinforces teaching to a client newly prescribed methotrexate MTX. Which of the following statements should the nurse include? Select all that apply. Choices. This medication may cause you to bruise more easily. You will need to take folic acid with this medication. You will need to remain upright for 30 minutes after taking a dose. This medication may cause your gums to get enlarged. Avoid large crowds and wash your hands frequently. Here are the options. Option A. This medication may cause you to bruise more easily. You will need to take folic acid with this medication. Avoid large crowds and wash your hands frequently. The correct answer is option A. This medication may cause you to bruise more easily. You will need to take folic acid with this medication. Avoid large crowds and wash your hands frequently. Correct answer. This medication may cause you to bruise more easily. You will need to take folic acid with this medication. Avoid large crowds and wash your hands frequently. Question 98. The nurse has just inserted an indwelling urinary catheter for a male client. The nurse plans on securing the catheter to the clients. Here are the options. Option A, inner thigh. Option B, lower abdomen. Option C, outer thigh. Option D, medial thigh. The correct answer is option B, lower abdomen. Correct answer, lower abdomen. When securing an indwelling urinary catheter for a male, it is appropriate to anchor it to the lower abdomen or upper thigh. The catheter tubing should be secured to the lower abdomen or the upper thigh to prevent urethral injury. Question 99. The nurse is caring for a 3-year-old diagnosed with bronchitis when the mother asks the nurse what this diagnosis means. Which of the following responses correctly explains bronchitis? Here are the options. Option A. Bronchitis occurs when an infection causes inflammation in the large airways. These include the trachea and bronchi, which are in the lower part of the respiratory tract. Option B. Bronchitis occurs when an infection causes inflammation in the small airways. These include the trachea and bronchi, which are in the upper part of the respiratory tract. Option C. Bronchitis occurs when an infection causes inflammation in the large airways. These include the trachea and bronchi, which are in the upper part of the respiratory tract. Option D. Bronchitis occurs when an infection causes inflammation in the small airways. These include the trachea and bronchi, which are in the lower part of the respiratory tract. The correct answer is option A. Bronchitis occurs when an infection causes inflammation in the large airways. These include the trachea and bronchi, which are in the lower part of the respiratory tract. Correct answer. Bronchitis occurs when an infection causes inflammation in the large airways. These include the trachea and bronchi, which are in the lower part of the respiratory tract. This statement correctly describes bronchitis to the mother. Bronchitis occurs when an infection causes inflammation in the large airways. These include the trachea and bronchi, which are in the lower part of the respiratory tract. Question 100. The licensed practical/vocational nurse LPN/VN is reviewing incident reporting. Which of the following situations would require an incident report? Select all that apply. Choices: a visitor refusing to wear personal protective equipment PPE. A visitor activating a patient's patient-controlled analgesia PCA device. A visitor requesting that their family member get pain medication. A visitor assisting their family member with brushing their teeth. A visitor stating that they fell while using the bathroom. Here are the options. Option A. A visitor refusing to wear personal protective equipment PPE. A visitor activating a patient's patient-controlled analgesia PCA device. A visitor stating that they fell while using the bathroom. The correct answer is option A. A visitor refusing to wear personal protective equipment PPE. A visitor activating a patient's patient-controlled analgesia PCA device. A visitor stating that they fell while using the bathroom. Correct answer: a visitor refusing to wear personal protective equipment PPE. A visitor activating a patient's patient-controlled analgesia PCA device. A visitor stating that they fell while using the bathroom. Question 101. The practical nurse is reinforcing prior teaching given to parents about antepartum testing. Which statements would be appropriate for the practical nurse to include? Select all that apply. Choices: oral glucose tolerance testing will measure fetal activity at certain intervals. A non-stress test may be used to measure fetal heart rate. Amniocentesis may be used to assess if you have preeclampsia. Chorionic villus sampling may be done to assess for neurotube defects. Here are the options. Option A. A non-stress test may be used to measure fetal heart rate. Group B Streptococcus GBS screening between 35 and 37 weeks. The correct answer is option A. A non-stress test may be used to measure fetal heart rate. Group B Streptococcus GBS screening between 35 and 37 weeks. Correct answer: a non-stress test may be used to measure fetal heart rate. Group B Streptococcus GBS screening between 35 and 37 weeks. A non-stress test is performed in the third trimester if the client has indications such as a high-risk pregnancy that may result in a stillbirth or complications such as fetal hypoxia. Group B Streptococcus testing is typically done during the third trimester of pregnancy, usually between 35 and 37 weeks. This is because GBS bacteria can be present in the vagina and rectum of some pregnant women and can be transmitted to the baby during childbirth, potentially causing serious infections. Question 102. While caring for a 6-week-old child, the LPN measures the client's temperature as 38.7 degrees Celsius. Which diagnostic tests does the LPN anticipate the provider to order? Select all that apply. Choices: complete blood count CBC blood cultures urinalysis X-ray of the chest electrocardiogram ECG. Here are the options. Option A. Complete blood count CBC. blood cultures, urinalysis. The correct answer is option A. Complete blood count CBC, blood cultures, urinalysis. Correct answer. Complete blood count CBC, blood cultures, urinalysis. Electrocardiogram ECG. Question 103. The licensed practical/vocational nurse LPN/VN is reinforcing teaching to a client about the newly prescribed medication, epoetin alpha. Which of the following information should the nurse include? Here are the options. Option A. This medication will decrease your risk of infection. Option B. You may notice black, tarry stools while on this medication. Option C. This medication may raise your blood pressure. Option D. Take this medication with food rich in vitamin C. The correct answer is option C. This medication may raise your blood pressure. Correct answer. This medication may raise your blood pressure. Epoetin alpha is an erythropoietic growth factor indicated to increase red blood cell production for those with chronic kidney disease. This medication expands blood plasma with the therapeutic effect of increasing hemoglobin and hematocrit. It is essential to monitor the client's blood pressure while taking this medication, as an increase in blood pressure may be seen secondary to the increased blood volume. Uncontrolled hypertension is a contraindication to this medication. Question 104. The nurse prepares a client for a computed tomography CT scan of their abdomen and pelvis with intravenous Roman for contrast. The nurse should take which action prior to the client's exam? Here are the options. Option A. Remove any medicated patches before the exam. Option B. Instruct the client to empty their bladder right before the test. Option C. Advise the client that they may experience a flushing sensation during the exam. Option D. Assess the client for an implantable pacemaker. The correct answer is option C. Advise the client that they may experience a flushing sensation during the exam. Correct answer. Advise the client that they may experience a flushing sensation during the exam. Flushing of the face is a response to the intravenous administration of contrast dye commonly seen in clients. Often, clients experience a warm sensation throughout the body once the intravenous contrast dye begins infusing. Usually, if the client does experience this warm sensation, clients will typically report the sensation occurring initially in the face and neck region. Shortly after, clients will often state they feel the warmth in their pelvic area. Question 105. The nurse is caring for a client who developed a thyroid storm. The nurse should obtain a prescription for. Here are the options. Option A. Enalapril. Option B. Regular insulin. Option C. Levothyroxine. Option D. Dexamethasone. The correct answer is option D. Dexamethasone. Correct answer. Dexamethasone. A thyroid storm is a medical emergency and is a complication of hyperthyroidism. Manifestations of a thyroid storm include fever, tachycardia, hypertension, and cardiac dysrhythmias. Emergent treatments for a thyroid storm include prescribed dexamethasone corticosteroids inhibit the peripheral conversion of T4 into T3, propranolol reduce heart rate and blood pressure, and an antithyroid medication such as propylfurazole. Question 106. The nurse is assisting a client with food choices appropriate for celiac disease. Which food items would be appropriate to select? Select all that apply. Choices: grilled chicken, wheat pasta, scrambled eggs, oatmeal beef patties. Here are the options. Option A. Grilled chicken, scrambled eggs, beef patties. The correct answer is option A. Grilled chicken, scrambled eggs, beef patties. Correct answer: grilled chicken, scrambled eggs, beef patties. Beef patties. Question 107. The nurse works collaboratively with a pharmacist to identify clients at risk for lithium toxicity. The client at most significant risk for lithium toxicity is a client with. Here are the options. Option A: asthma taking both long and short-acting bronchodilators. Option B: chronic migraine headaches and was newly prescribed naproxen. Option C: hypertension, newly prescribed clonidine transdermal patch. Option D: hypothyroidism and was recently prescribed levothyroxine. The correct answer is option B: chronic migraine headaches and was newly prescribed naproxen. Correct answer: chronic migraine headaches and was newly prescribed naproxen. NSAID naproxen, ibuprofen, ACE inhibitors lisinopril, enalapril, and diuretics furosemide, hydrochlorothiazide should be avoided while a client is taking lithium. ACE inhibitors promote sodium wasting and low levels of sodium precipitate lithium toxicity. NSAID reduce renal blood flow, cause lithium retention, and raise its serum level to a potentially toxic range. The client with aches and pains should be recommended acetaminophen. Question 108. The nurse is observing infection control practices in the nursing unit. Which of the following findings require follow-up? A client with select all that apply. Choices: pylori placed on standard precautions. Rotavirus provided a disposable blood pressure cuff. Rubella and their doors kept closed. Influenza ambulating in the hall with a surgical mask. Here are the options. Option A: rubella and their door is kept closed. Legionnaire's disease placed on contact precautions. The correct answer is option A. Rubella and their door is kept closed. Legionnaire's disease placed on contact precautions. Correct answer: rubella and their door is kept closed. Legionnaire's disease placed on contact precautions. These observations are inappropriate and require follow-up. The door should be closed in airborne isolation precautions, not droplet precautions. A client with rubella should be placed on droplet precautions. The minimum PPE required for droplet precautions is a surgical mask. Legionnaire's disease is not transmitted person to person, but rather through infected water or soil. This bacterium requires standard precautions. Question 109. Which of the following are potential complications of cleft lip and cleft palate in the infant? Select all that apply. Choices: ear infections, feeding difficulties, weight gain, speech delay. Here are the options. Option A: ear infections, feeding difficulties, speech delay. The correct answer is option A: ear infections, feeding difficulties, speech delay. Correct answer: ear infections, feeding difficulties, speech delay. Question 110. Which of the following foods can the nurse recommend to parents of toddlers who have constipation? Select all that apply. Choices: mac and cheese, whole grains, whole milk, black beans, yogurt, or kefir. Here are the options. Option A: whole grains, black beans, yogurt, or kefir. The correct answer is option A: whole grains, black beans, yogurt, or kefir. Correct answer: whole grains, black beans, yogurt, or kefir. yogurt or kefir. Question 111. Which of the following patient assignments would be appropriate for unlicensed assistive personnel? Here are the options. Option A. A 65-year-old male requiring sterile dressing changes. Option B. A 26-year-old female requiring a one-person assist in ambulating to the restroom. Option C. An 80-year-old male who is receiving enteral feedings continuously through an NG tube. Option D. A 16-year-old female who is 4 hours post-cardiac catheterization. The correct answer is option B. A 26-year-old female requiring a one-person assist in ambulating to the restroom. Correct answer. A 26-year-old female requiring a one-person assist in ambulating to the restroom. A 26-year-old female requiring a one-person assist in ambulating to the restroom would be an appropriate assignment for unlicensed assistive personnel UAP. UAP are skilled in assisting clients with ambulation, and this is within their scope of practice. Question 112. The licensed practical/vocational nurse LPN/VN is taking vital signs on a baby diagnosed with total anomalous pulmonary venous return TAPFR when the mother starts crying. Which of the below statements by the nurse is therapeutic? Here are the options. Option A. Don't cry. Your baby will be fine. Option B. I'm so sorry you are going through this. Would you like to talk? Option C. I'm sure this is hard, but your baby is doing so well. Option D. You think this is bad? You should see some of the other babies here. The correct answer is option B. I'm so sorry you are going through this. Would you like to talk? Correct answer. I'm so sorry you are going through this. Would you like to talk? This is a good example of therapeutic communication. The nurse has validated the mother's feelings and encouraged further dialogue to understand what the mother is upset about. Question 113. The licensed practical/vocational nurse LPN/VN cares for a child admitted with severe dehydration secondary to gastroenteritis. Which assessment data would be most reliable in determining the client's response to the prescribed intravenous fluid replacement? Here are the options. Option A. The number of stools in the past shift. Option B. The current weight compared to the admission weight. Option C. Mucous membrane assessment. Option D. The 24-hour urinary output. The correct answer is option B. The current weight compared to the admission weight. Correct answer. The current weight compared to the admission weight. Weight is the gold standard in determining fluid status. It provides an objective assessment of the client's overall fluid status. As a reminder, 1 kilogram equals 2.2 pounds, equivalent to 1 liter of fluid. If the client has an increase in 1 kilogram compared to their admission weight, they have responded favorably to the fluid replacement. Question 114. The LPN works in a community health clinic with new mothers and infants. Which of the following is accurate regarding expected growth in infants? Select all that apply. Choices. Infants should triple their birth weight by 12 months of age. Infants should double their birth weight by 6 months of age. Infants should triple their birth weight by 6 months of age. Infants should double their birth weight by 12 months of age. Infants should double their birth weight by 6 months of age. Here are the options. Option A. Infants should triple their birth weight by 12 months of age. Infants should double their birth weight by 6 months of age. The correct answer is option A. Infants should triple their birth weight by 12 months of age. Infants should double their birth weight by 6 months of age. Correct answer. Infants should triple their birth weight by 12 months of age. Infants should double their birth weight by 6 months of age. Infants should double their birth weight by 6 months of age. Question 115. The nurse is caring for a client prescribed a topical glucocorticoids. The nurse should monitor for all the following systemic effects of the medication except, here are the options. Option A. Mood changes. Option B. Osteoporosis. Option C. Liver toxicity. Option D. Adrenal insufficiency. The correct answer is option C. Liver toxicity. Correct answer. Liver toxicity. Liver toxicity is not a systemic effect associated with the use of glucocorticoids. Topical glucocorticoids or corticosteroids are used in cases of dermatitis and eczema to treat symptoms of burning, itching, and inflammation. They may also be used in conjunction with other medical therapies for the treatment of psoriasis. Question 116. The nurse has provided medication instructions to a client who has been prescribed venlafaxine. Which of the following statements, if made by the client, would indicate a correct understanding of the teaching? Select all that apply. Choices: I may not notice an improvement in my mood right away. This medication may lower my blood pressure. If I have thoughts of harming myself, I should call 911. I will need to have weekly laboratory tests. Here are the options. Option A. I may not notice an improvement in my mood right away. If I have thoughts of harming myself, I should call 911. The correct answer is option A. I may not notice an improvement in my mood right away. If I have thoughts of harming myself, I should call 911. Correct answer. I may not notice an improvement in my mood right away. If I have thoughts of harming myself, I should call 911. Venlafaxine is a serotonin norepinephrine reuptake inhibitor SNRI. This medication is used to treat depression and anxiety. Like most serotonergic drugs, the client may not experience an effect for 2 to 4 weeks. If no effect is achieved within 6 weeks, the prescriber may change the medication. Venlafaxine may increase thoughts of suicidal ideation, and the client should be educated to seek help if these thoughts should occur. Question 117. The nurse is collecting data on a client with schizophrenia. Which of the following would be an expected finding? Select all that apply. Choices: apraxia, avolition, delusions, bradykinesia, and anhedonia. Here are the options. Option A. Anhedonia, avolition, delusions. The correct answer is option A. Anhedonia, avolition, delusions. Correct answer: anhedonia, avolition, delusions. Question 118. The nurse has reinforced education to a client diagnosed with obstructive sleep apnea (OSA). Which client statement would indicate a correct understanding of the teaching? Here are the options. Option A. I should use an antiseptic mouthwash immediately before going to bed. Option B. I will plan on exercising at least 150 minutes a week. Option C. I have been reading about the potential for me needing supplemental oxygen overnight. Option D. I will sleep flat on my bed without any pillows. The correct answer is option B. I will plan on exercising at least 150 minutes a week. Correct answer. I will plan on exercising at least 150 minutes a week. A crucial part of mitigating the symptoms of obstructive sleep apnea is for a client to lose weight. Weight reduction is a pivotal part of the treatment plan for an individual with OSA, as being overweight or obese causes fat deposits in the upper airways. Reducing these fat deposits improves muscle activity and allows for better ventilation. The client stated that they plan on exercising 150 minutes a week is a favorable response because that is the national recommendation. Question 119. The nurse is reviewing isolation precautions for patient room assignments on the nursing unit. Which patient room assignment requires follow-up? Here are the options. Option A, Room 1. Option B, Room 2. Option C, Room 3. Option D, Room 4. The correct answer is option A, Room 1. Correct answer, Room 1. Lyme disease is not transmitted human to human. This client should be placed on standard precautions as are inappropriate. This client requires follow-up as the contact precautions are inappropriate. Question 120. The nurse is preparing to insert an indwelling urinary catheter. Which action may be delegated to the unlicensed assistive personnel UAP? Here are the options. Option A, set up the sterile field. Option B, palpate the bladder for distension. Option C, explain the procedure to the client. Option D, place the urinary catheter kit at the bedside. The correct answer is option D. Place the urinary catheter kit at the bedside. Correct answer. Place the urinary catheter kit at the bedside. This task is appropriate to delegate to the UAP. Gathering supplies, suction, vital sign equipment, etc. is within the scope of a UAP. Question 121. When orienting an older client to his hospital room safety measures, what is the admission routine's priority component? Here are the options. Option A, explain how to use the telephone. Option B, introduce the client to her roommate. Option C, review the hospital policy on visiting hours. Option D, explain how to operate the call light. The correct answer is option D. Explain how to operate the call light. Correct answer. Explain how to operate the call light. Knowing how to use the call light is a safety priority. Question 122. The nurse is caring for a 14-year-old scheduled for an appendectomy. What is the nurse's role in obtaining informed consent before surgery? Select all that apply. Choices: informing the parents that only the surgeon may withdraw the surgical consent, review the risks and benefits of the surgery with the parents, validate that the parents are competent to provide consent for the client, witness the signature on the informed consent, make sure that the consent is witnessed by 2 healthcare professionals. Here are the options. Option A, validate that the parents are competent to provide consent for the client. Witness the signature on the informed consent. The correct answer is option A. Validate that the parents are competent to provide consent for the client. Witness the signature on the informed consent. Correct answer. Validate that the parents are competent to provide consent for the client. Witness the signature on the informed consent. Since the client is 14, they are a minor, and their parents will be responsible for signing informed consent. The nurse is accountable for validating that the parents are competent to provide consent for the client. The nurse will serve as the witness for the informed consent. This is one of the primary responsibilities of the nurse when a client is getting a procedure and signing a consent. The other primary responsibility will be to serve as the client's advocate and ensure that the parents have received sufficient information to make an informed decision. If they have not, the nurse must call the surgeon to return and speak further with the parents. Question 123. The nurse is caring for a client with suspected meningitis. Which priority action should the nurse take immediately following a lumbar puncture procedure? Here are the options. Option A. Test for gag reflex return. Option B. Elevate the head of the bed to 30 degrees. Option C. Encourage oral fluid intake. Option D. Determine if the client is positive for the Brzezinski sign. The correct answer is option C. Encourage oral fluid intake. Correct answer. Encourage oral fluid intake. A lumbar puncture or spinal tap procedure is used to obtain cerebrospinal fluid CSF to diagnose meningitis and identify the cause. Following this procedure, the nurse would encourage oral fluid intake to replace CSF volume and reduce the risk of spinal headaches. Additionally, clients with suspected meningitis have a fever, and encouraging fluid intake would help reduce the fever and prevent dehydration. Question 124. The nurse is caring for clients in a long-term care facility. Which client is at the greatest risk for developing a decubitus ulcer? Here are the options. Option A. An incontinent client who had 3 diarrhea stools. Option B. An 80-year-old ambulatory diabetic client. Option C. A 79-year-old malnourished client on bed rest. Option D. An obese client who uses a wheelchair. The correct answer is option C. A 79-year-old malnourished client on bed rest. Correct answer. A 79-year-old malnourished client on bed rest. Prolonged inadequate nutrition causes weight loss, muscle atrophy, and the loss of subcutaneous tissue. These 3 conditions reduce the amount of padding between the skin and bones, thus increasing the risk of pressure ulcer development. More specifically, inadequate protein intake, carbohydrates, fluids, zinc, and vitamin C contribute to pressure ulcer formation. Several factors contribute to the formation of pressure ulcers: friction and immobility, inadequate nutrition, fecal and urinary incontinence, decreased mental status, diminished sensation, excessive body heat, advanced age, and the presence of certain chronic conditions. Question 125. The nurse is visiting a client who is 82 years old, has impaired vision, and lives alone. It would be necessary for the nurse to follow up if the client states which of the following. Select all that apply. Choices: I secured my throw rugs to the floor with tape. I switched to using an electric shaver instead of a razor. I usually sit in a recliner while I listen to the television. I use different shaped containers with lids to organize my medications. I use the upstairs bathroom instead of the one downstairs. Here are the options. Option A. I secured my throw rugs to the floor with tape. I use the upstairs bathroom instead of the one downstairs. The correct answer is option A. I secured my throw rugs to the floor with tape. I use the upstairs bathroom instead of the one downstairs. Correct answer. I secured my throw rugs to the floor with tape. I use the upstairs bathroom instead of the one downstairs. An older client with impaired vision that lives alone has significant risk factors for falls. The nurse should follow up if the client states that they secured the scattered rugs with tape. The client should not have any scattered rugs. Finally, a client climbing the stairs to use the bathroom increases the risk of falls. The nurse should advise the client to use the closest bathroom. Question 126. When a nursing student asks a nurse on her assigned floor what cyanosis means, what is the nurse's best response? Here are the options. Option A. Cyanosis means the client has been exposed to cyanide poisoning. Option B. Cyanosis is the blue coloring of the skin and mucous membranes in the presence of poorly oxygenated blood. Option C. Cyanosis is the primary indication that the client has pneumonia. Option D. Cyanosis is the blue coloring of the skin and mucous membranes in the presence of highly oxygenated blood. The correct answer is option B. Cyanosis is the blue coloring of the skin and mucous membranes in the presence of poorly oxygenated blood. Correct answer. Cyanosis is the blue coloring of the skin and mucous membranes in the presence of poorly oxygenated blood. Cyanosis is the bluish discoloration of the skin and mucous membranes caused by decreased peripheral circulation or reduced oxygenation of the blood. It may be related to cardiac, pulmonary, or peripheral vascular problems, for example, arteriosclerosis. In dark-skinned clients, you can best see cyanosis by examining the conjunctiva, tongue, buccal mucosa, palms, and soles for a dull dark color. Question 127. The nurse is conducting presurgical assessments on clients at an ambulatory care center. In which scenario should the nurse report to the surgeon, as it may necessitate postponing surgery? Here are the options. Option A. A 20-year-old client who is a vegan. Option B. An elderly client who intakes daily nutritional drinks. Option C. A 40-year-old client who takes ginkgo biloba and aspirin daily. Option D. An infant who is breastfeeding. The correct answer is option C. A 40-year-old client who takes ginkgo biloba and aspirin daily. Correct answer. A 40-year-old client who takes ginkgo biloba and aspirin daily. Ginkgo biloba herbal, aspirin, and vitamin E all have anticoagulant properties. It is vital to notify the surgeon about these medications to decrease the client's risk of excessive bleeding. Question 128. The nurse is in an elevator and observes two staff members discussing a client's condition. The nurse understands that this conversation may potentially violate which ethical principle? Here are the options. Option A. Beneficence. Option B. Confidentiality. Option C. Autonomy. Option D. Veracity. The correct answer is option B. Confidentiality. Correct answer, confidentiality. This discussion observed by the nurse does not potentially violate these ethical principles. Beneficence refers to taking positive actions to help others over themselves. Autonomy refers to protecting and promoting client independence. Veracity is an ethical principle referring to telling the truth. Honesty supports a trusting nurse-client relationship. This conversation being observed by the nurse may violate the client's confidentiality. Conversations about a client's personal medical information (PMI) should be kept private and involve only those involved in the client's care. This is considered the which mandates that information be safeguarded and limited in how it is shared. Question 129. Your client is experiencing severe, acute anxiety before a scheduled endoscopy procedure. Which of the following medications is most likely to be ordered by the physician? Choices: oxycodone, clonazepam, haloperidol, midazolam. Here are the options. Option A. Midazolam. The correct answer is option A. Midazolam. Correct answer, midazolam. Midazolam is a benzodiazepine used for acute anxiety attacks. Midazolam is preferred in this setting because of its rapid onset 2 to 5 minutes after Roman 4 administration and short duration of action 3 to 8 hours. It can be administered intravenously or orally. Given these benefits, midazolam would be the most useful for the client experiencing an acute anxiety attack prior to / during endoscopic procedures or prior to surgery. Question 130. The nurse is working with a client who suffers from obsessive-compulsive disorder (OCD). The client has an obsession with the dangers of germs and performs compulsive hand washing hundreds of times per day. Which of the following should the nurse include in this client's treatment plan? Select all that apply. Choices: create a schedule for the hand washing ritual. Teach about the dangers of overwashing their hands. Incorporate meditation into their daily schedule. Block the sink so the client is not tempted to wash their hands. Here are the options. Option A. Create a schedule for the hand washing ritual. Incorporate meditation into their daily schedule. Administer fluoxetine as ordered. The correct answer is option A. Create a schedule for the hand washing ritual. Incorporate meditation into their daily schedule. Administer fluoxetine as ordered. Correct answer: create a schedule for the hand washing ritual. Incorporate meditation into their daily schedule. Administer fluoxetine as ordered. Question 131. The nurse is caring for a client diagnosed with trichotillomania. The nurse anticipates a prescription for which medication from the primary healthcare provider PHCP? Here are the options. Option A. Fluoxetine. Option B. Amphetamine. Option C. Haloperidol. Option D. Bupropion. The correct answer is option A. Fluoxetine. Correct answer: fluoxetine. Trichotillomania is a syndrome that causes a client to engage in hair pulling. This disorder is categorized as an obsessive-compulsive disorder. Common sites for hair pulling include the eyebrows, scalp hair, and chin. Selective serotonin reuptake inhibitors (SRIs) combined with psychotherapy are effective treatments for this disorder. Medications that may be used include fluoxetine, citalopram, or paroxetine. Question 132. The nurse is collecting data on a client with Paget's disease. Which of the following would be an expected finding? Here are the options. Option A. Bone deformities. Option B. Berry aneurysm. Option C. Heparin's nodes. Option D. Janeway lesions. The correct answer is option A. Bone deformities. Correct answer: bone deformities. Paget's disease is a disease caused by a bone becoming weakened and remodeled, which may result in deformities. The most common area this inappropriate bone remodeling affects is the skull, pelvis, and spine. Question 133. During a physical assessment, the nurse inspects the client's abdomen. What assessment technique would the nurse perform next? Here are the options. Option A. Percussion. Option B. Palpation. Option C. Auscultation. Option D. Whichever is most comfortable for the patient. The correct answer is option C. Auscultation. Correct answer: auscultation. Question 134. The nurse is caring for a client diagnosed with Lyme disease. The nurse anticipates the primary healthcare provider PHCP prescribe which medication? Here are the options. Option A. Doxycycline. Option B. Enalapril. Option C, simvastatin. Option D, famotidine. The correct answer is option A, doxycycline. Correct answer, doxycycline. Doxycycline is an effective treatment for Lyme disease. Lyme disease is an infectious disease caused by the Borrelia bacterium, spread by ticks. The most common sign of infection is an expanding area of redness on the skin, known as erythema migrans, that appears at the tick bite site about a week after it occurred. The rash is typically neither itchy nor painful. The rash is classically referred to as a bullseye rash. Question 135. The nurse is caring for a 10-year-old client with a tracheostomy tube. The nurse notes that the client has a large volume of secretions and prepares to suction the client. Which of the following actions should she take first? Here are the options. Option A, hyperoxygenate the client. Option B, ask the client to take a deep breath. Option C, place the client supine. Option D, notify the RN. The correct answer is option A, hyperoxygenate the client. Correct answer, hyperoxygenate the client. It is necessary to hyperoxygenate the client prior to taking any of the other actions. This is one of the first steps in suctioning a tracheostomy. The nurse hyperoxygenates the client to prepare them for the procedure and prevent desaturations. The nurse then inserts the suction catheter without suctioning to the pre-measured depth, applies intermittent suction and rotates the suction catheter as it is removed from the tracheostomy. Question 136. The nurse is reviewing dietary teaching with a client who has hypercalcemia. Which of the following foods are high in calcium and should be avoided in the dietary recommendations? Select all that apply. Choices: broccoli, 2% milk, whole wheat pasta, bananas, salmon. Here are the options. Option A, broccoli, 2% milk, salmon. The correct answer is option A, broccoli, 2% milk, salmon. Correct answer, broccoli, 2% milk, salmon. Fish such as sardines and salmon are also high in calcium and should be limited on a low-calcium diet. Question 137. You are the nurse performing education for a client with AIDS at the community clinic. Which of the following statements is an example of appropriate teaching? Here are the options. Option A, do not wash your dishes with your roommate's dishes. Option B, clean all utensils and dishes before reusing them. Option C, do not use the same shower or toilet as your roommate. Option D, hand sanitizer is not necessary unless you plan on touching someone else. The correct answer is option B. Clean all utensils and dishes before reusing them. Correct answer. Clean all utensils and dishes before reusing them. Stagnant water and food particles can be a breeding ground for pathogenic microorganisms. A client with an AIDS diagnosis is susceptible to contracting illness/infections more quickly due to the deficiency in his or her immune system. The focus of education should include measures to protect the client from contracting illnesses from others. Question 138. A pregnancy-related spinal change that can alter mobility is known as. Here are the options. Option A, ankylosing spondylosis. Option B, lordosis. Option C, scoliosis. Option D, kyphosis. The correct answer is option B, lordosis. Correct answer, lordosis. As a fetus grows, a variety of changes appear in a pregnant woman's body. The thoracic and lumbar spine curvature change, pain in the low back and pelvic region can increase. Balance and gait patterns also change. Some studies report that the center of gravity of pregnant women moves towards the abdomen, resulting in an increase in lumbar lordosis, posterior tilt of the sacrum, and movement of the head to the back to compensate for the increased weight as the fetus grows. Question 139. The LPN is educating a group of new graduate nurses on the cardiovascular system. Which of the following statements best describes the cardiovascular system? Here are the options. Option A. It has a heart with 6 chambers, strong vessels, and valves. Option B. It is a double pump circulating blood out to the lungs and the body. Option C. It includes concepts of precontractility, postcontractility, and load. Option D. It functions with a conduction system and starts in the ventricles. The correct answer is option B. It is a double pump circulating blood out to the lungs and the body. Correct answer. It is a double pump circulating blood out to the lungs and the body. This statement is correct. The heart is a double pump with. Question 140. A nurse is working in a busy medical surgical unit and has received report on the following 4 clients. The nurse should first see the client with. Here are the options. Option A. A client who underwent surgery yesterday and is complaining of incisional pain at a level of 8/10. Option B. New-onset atrial fibrillation who is complaining of chest pain. Option C. Diabetes who has a foot wound that appears infected and an oral temperature of 100.4 degrees F 38 degrees C. Option D. Advanced Alzheimer's disease who is confused and has had a recent fall. The correct answer is option B. New-onset atrial fibrillation who is complaining of chest pain. Correct answer. New-onset atrial fibrillation who is complaining of chest pain. New-onset atrial fibrillation and complaint of chest pain indicate a potentially serious cardiac issue that requires immediate attention. Chest pain can be a symptom of or unstable angina, which requires prompt assessment and intervention to help prevent further complications. Therefore, this client should be the nurse's first priority. Question 141. Which of the following statements regarding mass casualty events are true? Select all that apply. Choices. Mass casualties are events that overwhelm local medical capabilities. When a mass casualty occurs, there is a need to increase the staff at the hospital. Many local agencies will collaborate to handle a mass casualty situation. An example of a mass casualty event is a fight between visitors in the intensive care unit. Here are the options. Option A. Mass casualties are events that overwhelm local medical capabilities. When a mass casualty occurs, there is a need to increase the staff at the hospital. Many local agencies will collaborate to handle a mass casualty situation. The correct answer is option A. Mass casualties are events that overwhelm local medical capabilities. When a mass casualty occurs, there is a need to increase the staff at the hospital. Many local agencies will collaborate to handle a mass casualty situation. Correct answer. Mass casualties are events that overwhelm local medical capabilities. When a mass casualty occurs, there is a need to increase the staff at the hospital. Many local agencies will collaborate to handle a mass casualty situation. Question 142. When caring for an infant during cardiac arrest, which pulse must be palpated to determine cardiac function? Here are the options. Option A. Carotid. Option B. Brachial. Option C, pedal. Option D, radial. The correct answer is option B, brachial. Correct answer, brachial. The brachial pulse is the most accessible pulse on an infant, thus it is the site of choice. Accurate assessment of heart rate, breathing, and color is an essential part of infant resuscitation. The guidelines state that heart rate may be assessed using a stethoscope or palpating the umbilical, brachial, or femoral pulse. Question 143. The nurse has received an assignment of 4 clients on the medical surgical floor. Which client should she check on first? Here are the options. Option A, a 61-year-old male client that is 1 day post-op from hernia repair, complaining of pain at the incision site. Option B, a 68-year-old female client with type Roman II diabetes, complaining of stomach discomfort. Option C, a 72-year-old male client with emphysema and a history of uncontrolled hypertension, complaining of a headache. Option D, a 70-year-old female patient who is 2 days post-op from ankle surgery, complaining of some shortness of breath. The correct answer is option D, a 70-year-old female patient who is 2 days post-op from ankle surgery, complaining of some shortness of breath. Correct answer, a 70-year-old female patient who is 2 days post-op from ankle surgery, complaining of some shortness of breath identifies the physiological or biological needs, including the ABCs, the safety/psychological/emotional needs, the need for love and belonging, the requirements for self-esteem, and others' esteem, and self-actualization needs in that order of priority. The ABCs identify the airway, breathing, and cardiovascular status of the client as the highest priority in that sequential order. Question 144. Which of the following terms refers to the first stool passed by a newborn infant? Here are the options. Option A, melena. Option B, meconium. Option C, diarrhea. Option D, hematemesis. The correct answer is option B, meconium. Correct answer, meconium. Meconium is defined as the first stool passed by a newborn infant. It is typically a dark black/green sticky stool. Question 145. You are reinforcing education with the parents of a toddler suffering from gastroesophageal reflux disease GERD. You know they understand your teaching when they make which of the following statements? Select all that apply. Choices. We should feed him 6 small meals a day instead of a few big ones. Making sure he is sitting upright while eating may help the reflux. He should try to sleep on his left side so that his stomach can empty more easily. There are no medications that can help with this disease, so we will have to make lifestyle changes. Here are the options. Option A. We should feed him 6 small meals a day instead of a few big ones. Making sure he is sitting upright while eating may help the reflux. The correct answer is option A. We should feed him 6 small meals a day instead of a few big ones. Making sure he is sitting upright while eating may help the reflux. Correct answer. We should feed him 6 small meals a day instead of a few big ones. Making sure he is sitting upright while eating may help the reflux. Small, frequent meals are an excellent recommendation to help alleviate GERD symptoms. This will ensure the stomach does not overfill and help decrease the amount of reflux the client is experiencing. Question 146. A 40-year-old client who is blind and deaf has been admitted to the medical floor. What is the nurse's primary responsibility for this client? Here are the options. Option A. Make others aware of the client's deficits. Option B. Communicate with the nursing supervisor any client safety concerns. Option C. Continuously update the client on the social environment. Option D. Provide a safe and secure environment. The correct answer is option D. Provide a safe and secure environment. Correct answer. Provide a safe and secure environment. The nurse's primary responsibility is client safety. For this deaf and blind client, it is critical to provide a secure environment. Question 147. The nurse is ambulating a client who is wearing a gait belt. The client begins to fall. The nurse should take which appropriate action to minimize injury? Here are the options. Option A. Hold the gait belt, extend one leg, let the client slide against the leg, and lower the client to the floor. Option B. Let go of the gait belt, grab the client under each arm, and gently lower the client to the floor. Option C. Grasp the gait belt and instruct the client to fall gently down to the floor in a side-lying position. Option D. Hold the gait belt and lower the client to the floor by using a narrow base of support. The correct answer is option A. Hold the gait belt, extend one leg, let the client slide against the leg, and lower the client to the floor. Correct answer. Hold the gait belt, extend one leg, let the client slide against the leg, and lower the client to the floor. For a client who is ambulating, the nurse should always be slightly behind the client and positioned on the affected weaker side. If a client starts to fall, the nurse should hold the gait belt, try to extend one leg, let the client slide against the leg, and gently lower the client to the floor, protecting the head. The nurse can help prevent client injury by maintaining a wide base of support. Question 148. The nurse plans care for a client with moderate Alzheimer's disease AD. Which of the following interventions should the nurse include? Here are the options. Option A. Provide a low-stimulation environment with adequate lighting. Option B. Quiz the client with orientation questions. Option C. Change assigned staff to avoid burnout. Option D. Provide a broad range of choices. The correct answer is option A. Provide a low-stimulation environment with adequate lighting. Correct answer. Provide a low-stimulation environment with adequate lighting. When caring for a client with moderate Alzheimer's disease, the nurse should provide a low-stimulated environment with adequate lighting. The rationale for giving a low-stimulated environment is to allow the client to cognitively process one task at a time and not become distracted. Question 149. The nurse has received the following prescriptions for newly admitted clients. It would be a priority for the nurse to administer which prescription? Here are the options. Option A. Aspirin to a client experiencing an acute myocardial infarction. Option B. Lisinopril to a client with essential hypertension. Option C. Risperidone to a client with schizophrenia. Option D. Levodopa-carbidopa to a client with Parkinson's disease. The correct answer is option A. Aspirin to a client experiencing an acute myocardial infarction. Correct answer. Aspirin to a client experiencing an acute myocardial infarction. A client experiencing a is an acute emergency that requires immediate intervention. The standard treatment includes in no order morphine, oxygen, nitroglycerin, and aspirin. Question 150. After reporting to her usual adult medical surgical floor, the LPN is told she must float to the mother-baby unit. The LPN has never cared for this patient population before. Which of the following actions is most appropriate? Here are the options. Option A. Refuse the assignment. Option B. Float to the mother-baby unit and identify tasks within her training that she can safely perform. Option C. Call the nurse manager. Option D. Float to the mother-baby unit and ensure no one knows her inexperience. The correct answer is option B. Float to the mother-baby unit and identify tasks within her training that she can safely perform. Correct answer. Float to the mother-baby unit and identify tasks within her training that she can safely perform. Floating to the mother-baby unit and identifying tasks within her training that she can safely perform is the correct action. This promotes patient safety and benefits both the nurse and the unit. Question 151. The nurse has reinforced medication instruction to a client who has been prescribed methadone for opioid use disorder. Which of the following statements, if made by the client, would indicate a correct understanding of the instructions? Select all that apply. Choices. I will need counseling while taking this medication. I will need periodic blood tests while on this medication. This medication may lower my risk for hepatitis C. This medication will send me into opioid withdrawals. Here are the options. Option A. I will need counseling while taking this medication. I will need periodic blood tests while on this medication. This medication may lower my risk for hepatitis C. The correct answer is option A. I will need counseling while taking this medication. I will need periodic blood tests while on this medication. This medication may lower my risk for hepatitis C. Correct answer. I will need counseling while taking this medication. I will need periodic blood tests while on this medication. This medication may lower my risk for hepatitis C. Question 152. A client with a crush injury to her left arm calls the nurse's station and requests pain medication. An hour after administration, the client is still complaining of intense pain. What is the next nursing action? Here are the options. Option A. Ask the client to describe the pain in quality and intensity. Option B. Offer the client a distraction, such as a book or television. Option C. Tell the client she can have more medication in 3 hours. Option D. Tell the client that crush injury victims should expect intense pain. The correct answer is option A. Ask the client to describe the pain in quality and intensity. Correct answer. Ask the client to describe the pain in quality and intensity. Unrelieved pain is an indication of a complication. Clients who experience a crush injury are at risk for developing. Therefore, asking the client to be specific about the quality and intensity of pain is vital in reevaluating the client's status. A crush wound is a wound caused by a force that leads to compression or disruption of tissues. It is often associated with fractures. Usually there is minimal to no break in the skin. While other external symptoms, such as bruising or edema, may be visible, nurses should also rely on subjective symptoms reported by the client. Question 153. The nurse is validating a client's understanding of the management of low back pain. Which of the following statements should the nurse reinforce? Here are the options. Option A. Avoid bending at the waist and lifting heavy objects. Option B. Weight-bearing exercises are recommended. Option C. Increase your sun exposure and calcium intake. Option D. Lay on your stomach 4 times a day and flex your legs. The correct answer is option A. Avoid bending at the waist and lifting heavy objects. Correct answer. Avoid bending at the waist and lifting heavy objects. Low back pain symptoms may be mitigated using activity restriction as well as medications such as non-steroidal anti-inflammatory drugs and NSAIDs. Bending at the waist and lifting heavy objects would not be recommended for a client with low back pain. Question 154. The nurse is caring for a client receiving lorazepam. Which of the following reported herbal supplements would require follow-up? Select all that apply. Choices: kava, glucosamine, valerian, garlic, saw, palmetto. Here are the options. Option A. Kava, valerian. The correct answer is option A. Kava, valerian. Correct answer: kava, valerian. Lorazepam is a CNS depressant, and the client should avoid potentiating the effects of this medication. Herbal products such as kava and valerian are CNS depressant medications that should not be given concurrently while a client receives lorazepam. Lorazepam and one of these medications may cause profound sedation. Question 155. *NGN*. The nurse is removing an indwelling urinary catheter. Item 1 of 1. Here are the options. Option A. Further deflate the catheter. The correct answer is option A. Further deflate the catheter. Correct answer: further deflate the catheter. The amount of fluid removed from the balloon that secures the catheter in place inside of the bladder was inadequate. 10 ml of fluid is typically used to inflate the catheter balloon to keep it secure inside the bladder. The nurse should further deflate the catheter balloon by passively allowing the fluid to fill the syringe. The nurse may gently pull back on the syringe plunger if this does not work. By removing the residual volume, the nurse should then remove the catheter. Question 156. *NGN*. The nurse cares for a client 6 hours post-operative following a transurethral resection of a prostate TURP. Item 1 of 1. Choices: blood pressure 100/60 mmHg. Drag words from the choices below to fill in the blank in the following sentence. Intake: continuous bladder irrigation. 550 ml for shock. Here are the options. Option A. Shock. The correct answer is option A. Shock. Correct answer: shock. Respiratory rate 9 breaths per minute following a TURP procedure. Clients should be monitored quite closely for hypovolemic shock, likely to occur within the first 24 hours post-operatively. An early manifestation of shock is tachycardia and restlessness. The client's vital signs show tachycardia and low blood pressure, not hypotensive yet. The ketchup-like output supports the shock finding with medium to large clots. This type of output is concerning. Question 157. The licensed practical/vocational nurse LPN/VN is caring for a primigravida client with the following clinical data. The LPN/VN should take which action based on the result? Here are the options. Option A. Interpret this result as normal. Option B. Prepare the client for a contraction stress test. Option C. Anticipate in order for repeat testing. The correct answer is option A. Interpret this result as normal. Correct answer: interpret this result as normal. A reactive NST is an expected finding and indicates fetal well-being. In a reactive NST, 2 or more FHR accelerations of at least 15 beats per minute, lasting at least 15 seconds from the beginning of the acceleration to the end, in association with fetal movement, for 20 minutes. Question 158. The nurse observes sparks fly from a client's bathroom light. Which action should the nurse take first? Here are the options. Option A. Obtain a fire extinguisher. Option B. Close the bathroom door. Option C. Remove the client from the room. Option D. Activate the fire alarm. The correct answer is option C. Remove the client from the room. Correct answer. Remove the client from the room. The safety of the client is the highest priority in any emergency situation. Removing the client from the room is the first and most crucial action to protect them from potential harm, such as electrical shock or fire-related injuries. Question 159. The nurse is caring for a client who is recovering from abdominal surgery. There is a noticeable pinkish fluid oozing from the incision site. Which phase of the inflammatory response does this represent? Here are the options. Option A. Vascular response. Option B. Cellular response. Option C. Exudate formation. Option D. Healing. The correct answer is option C. Exudate formation. Correct answer. Exudate formation. The fluid and white blood cells that leak from blood vessels in response to injury/inflammation are exudates. Exudates are present in the wounds as they heal. The nature and quantity of exudate depend on the severity of the damage and the tissues involved. For example, a surgical incision may ooze clear or pinkish serous or serasanguinous exudate for a day or two. If an exudate becomes purulent thick, tan, green, or yellow, it is not normal and may suggest infection. In such cases, the nurse should immediately notify the healthcare provider. Question 160. A client with a vancomycin-resistant Enterococcus viri infection is admitted to the medical unit. Which action can be delegated to a nursing assistant who is assisting with the client's care? Here are the options. Option A. Implement contact precautions when handling the client. Option B. Educate the client and family members on ways to prevent transmission of VRE. Option C. Monitor the results of the laboratory culture and sensitivity test. Option D. Collaborate with other departments when the client is transported for an ordered test. The correct answer is option A. Implement contact precautions when handling the client. Correct answer. Implement contact precautions when handling the client. All hospital personnel who care for the client are responsible for the correct implementation of. Question 161. The LPN's client assignment includes a fresh post-opcal cystectomy client. Which of the following interventions are appropriate to decrease the risk of atelectasias? Select all that apply. Choices: deep inspiration, supine position with the head end of the bed elevated, change position every 2 hours, encourage the patient to cough at least 10 times /HR, promote early ambulation. Here are the options. Option A. Deep inspiration. Supine position with the head end of the bed elevated. Change position every 2 hours. The correct answer is option A. Deep inspiration. Supine position with the head end of the bed elevated. Change position every 2 hours. Correct answer. Deep inspiration. Supine position with the head end of the bed elevated. Change position every 2 hours. Changing client positions every 1-2 hours increases mobility, allowing full chest expansion and increased perfusion to the lungs. Question 162. A 12-year-old client with chronic asthma exacerbations has decided to try guided imagery as a way to manage anxiety contributing to asthma attacks. Which of the following statements by the client indicates an understanding of this stress reduction technique? Here are the options. Option A: I can do this anytime and anywhere when I feel anxious. Option B: I must be lying down to practice guided imagery. Option C: my mom will have to be with me anytime I try this. Option D: I will play music every time I do my guided imagery to make sure it works. The correct answer is option A. I can do this anytime and anywhere when I feel anxious. Correct answer: I can do this anytime and anywhere when I feel anxious. Guided imagery is a stress reduction technique that can be done in any place at any time. In fact, this is one of the biggest advantages of this technique. Anytime the client begins to feel anxious, they can practice guided imagery.